किया है. Okay. 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 So now should I start? Hello. हाँ जी. हाँ, वॉइस का मैं देखता हूँ. हाँ. 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 ओके, चलो ठीक है. थैंक. हेलो हेलो हेलो. गुड. Good morning, students. Good morning. Am I visible to all? Am I audible to all? Can all of you see me? Can all of you hear me? Voice okay? Good morning. Yes, okay. Voice will become better now. I'm just starting the headphone. Yes. Okay. Welcome all of you to very important session. One very important point. Please don't use the chat box in the app. Use 1 second. Huh? I'm just putting use only Telegram for chat during live class. Can somebody pin this comment? How can I pin this? Okay, I don't know how to pin. Okay, yes. Can somebody just pin this comment so that the students who are joining us new will be aware that you are only supposed to use this chat box of the Telegram for continuous answering during the session. Am I visible to all? Am I audible to all? So we meet after a quite a big break. I hope all of you, many of you have joined in now today. Just a second, is the or yes. Yes, perfect. Okay, I'll just quickly give you the background and then we start right away. So we had taken theory sessions over 7 to 8 days in the month of March, and I hope all of you have seen those detailed theory lectures. If you have seen them, then this lecture is going to be very easy for all of you. But even if you have not seen those theory classes and directly you are coming in for this RR session, no problem. We will try our best so that you will understand the concept, and majority of the questions from this only is going to come in your FMG examination. And I can assure you, every year students tell me that from your lecture only everything was coming. Okay, now point number one, we have got two sessions. Today is Friday and then we meet on Monday. Okay, Friday, today we are discussing all the gynecology MCQs, and Monday we are going to meet to discuss all the obstetric MCQs. These MCQs will be covering your PYQs also. Yeah, this will be covering your PYQ. I will be covering all the PYQs, all the clinical cases, and all the image based questions also I will be covering. Is this clear to all of you? And I want it to be a participative session. I want it to be a participative sessions. I will be putting forward the question. I will be putting forward the question, and I want all of you to participate and answer. Right, wrong does not matter. Okay. Yes, beta. Siri, whatever will be possible, will be covering in what 3 and 4 hours time. We have got total 7 to 8 hours time in today and Monday. Whatever possible, we will be covering. Okay. And rest all the everything. This is like a revision. All the detailed theory lectures we have covered. Everything. This is like a rapid revision. Okay. And I hope all of you will enjoy. Okay. Now point number one. Let us begin. Is the rules clear? Don't go home with any doubts. Feel free to ask question, answer question, and I want all of you to participate. Yeah. Thank you. Okay. Thank you. Yes, okay. So let us begin the discussion. And the first question for that, I want all of you to participate. 25-year-old female, clinical case scenario, PYQ, cohabitating 6 months, brought to the OPD by mother-in-law. Next step is, first I'm giving 5 to 6 questions for all of you, and then we'll discuss. Okay. Yes. Chalo, answer. I hope all of you is the audio video all clear. I want at least, I want all of you to answer. Right, wrong does not matter. Okay. We will be giving 10 seconds and then we'll be shifting on to the next question. Is this understood to all of you? Yes. Okay. Don't worry. Picture abhi baki hai. Detailed explanation is all coming up in some time. Moving on. Yes. Next. 26-year-old married lady, married for 3 years, obesity, hirsutism, oligo, anxious to conceive. Which of the following will not be useful in the management of this at present? A, B, C, D. Okay, 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 very good, very good. A, B, C, D, A, B, C. Yes. Okay, okay, okay. Moving on, moving on. Once I know 5 10 students have answered, we will be shifting to the next question. Okay, because I'm explaining this is a technique. We are first going to show you questions so that you can then this. Next MCQ, quickly. Okay, quickly. Diagnosis, everything is coming. Don't worry. Married since 3 years, obesity, acne, hirsutism, patient is anxious to conceive. Again over here, which of the following is the most appropriate treatment in the management of this condition? A, B, C, D. Okay, okay, okay. The trick, the difficult. Okay, okay, fine, superb. Okay, moving on to the next question. Yes, again, 20-year-old comes for treatment of hirsutism. Levels are given to is the most appropriate treatment for her condition. A, B, C, D. So all these are extremely important questions. Sure, short. If you do not know this, then there is problem. Okay, and all of you will become experts and champions by the end of this session. Moving on, all of the following are increased in PCOS except. Okay, so 5 6 questions, then we discuss further. Okay, all are increased in PCOS except. Okay, and this one, and then we discuss for. Okay, patient presents with infertility, history of dyspareunia, dysmenorrhea, uterus is retroverted, nodularity in the pouch of Douglas. Best investigation for this patient to be done is, and anybody with the diagnosis also, very important. Many of you are getting it wrong. Okay. Yes. Okay, moving on, and these set of questions we discussed later. Okay, so let us begin our session. Welcome to the session, those who are joining in now also. Point number one, we'll be discussing all these things and then we move forward. Okay, now point number one, the definition of infertility. This is not a patient of infertility because they are married or cohabitating only since 6 months. So please understand this. Let the patient be brought to the OPD by mother-in-law, father-in-law, neighbor, जिसको भी साथ में लाना है. Point number one, what happens is that in one particular month, in 1 month, when the couple has unprotected sex, only 10 to 15% couple can achieve a pregnancy. तो वो खाली एकता कपूर के सीरियल में होता है एंड हिंदी पिक्चर में होता है कि हीरो हीरोइन मीट एंड हीरोइन प्रेग्नेंट इन द फर्स्ट शॉट इटसेल्फ. Okay, and that only happens in Hindi picture and Ekta Kapoor serial. In real life, there will take time, and therefore the definition of infertility is 1 year, because in 1 year, thank you. Okay, with 1 year, there is how many percentage, sir? By the end of 1 year of regular unprotected intercourse, 90% couple will be able to achieve a pregnancy. 90%. And 10, so after 1 year, 90% will conceive and 10% will remain infertile, and those are not yet pregnant, and those are the ones whom we further investigate. Why? Because if you start investigating early, the stress goes up, and with stress the further success goes down. Is it clear? So that is why don't unnecessarily stress the patient. Tell them relax, meditation, yoga से होगा. Okay, कहने का मतलब ये है कि they are married only 6 months. Yes, tell them go back home, relax, enjoy. Go back home and enjoy. If after another 6 more months also, very good, Jimit. Come back after 6 months if you are not yet pregnant. And therefore you don't do any of this investigation except just doing reassurance, guiding to them when is the fertile period, when is the maximum chance of pregnancy. Yes, anybody, one more thing which I should do. Tell me over here, smart doctor, thinking doctor, intelligent doctor, यहाँ पे I can start one tablet to the female. What tablet can I start to the lady? Because she can conceive in the next month, 2 months, 3 months. She's planning pregnancy. Okay, what will I do apart from reassurance? Of course, reassurance is the answer, and all those who have marked C is correct. But what else can we do for this patient? Anybody? Yes, excellent. Because sir, all of you know कि folic acid is best given preconceptional, periconceptional. So any patient, because which month she will conceive, we don't know. Okay, so just start her on folic acid every day and tell her that this is to prevent neural tube. Again, very famous. So with this many MCQs, with one question I discussed 10 other question. Folic acid is for neural tube defect prevention. So any patient, so the very simple thing, any of your friends, relatives, auntie, cousin calls you, I'm planning pregnancy, just tell them to start folic acid supplementation. Okay, is it clear to all of you? So this is for neural tube defect, and reassurance is the answer. Very good over here. Moving on, if there's any doubt, please let me know. Now, please understand this next question here is again infertility. Now, married since 3 years, and what is the diagnosis based on the clinical symptoms? Obesity, hirsutism, irregular periods. So this goes in favor of PCOS as the diagnosis. Now very quickly, all of you, my dear student, who's short MCQ, which criteria we use for PCOS diagnosis? Whose criteria we use? Which criteria we use for PCOS? Okay, the criteria which we use for diagnosis of PCOS, Rotterdam criteria. And the 3 criterias, any 2 out of 3 should be present. What are the Rotterdam criteria? Criteria number 1 should be an ovulation, or basically oligo-ovulation. Excellent, all of you. This an ovulation I can come to know because she's not getting her periods regularly. Periods are not regular. An ovulation. Second could be hyperandrogenism. This hyperandrogenism could be biochemical or clinical. Biochemical means increase in testosterone, and clinical means acne, hirsutism, facial hair. Please be understand, I will have to be a little bit quicker because we have got limited time. I have been given only 2 days time to cover my today and the next session. Okay, very good. And third is the ultrasonography criteria. Picture, I will show you picture abhi baki hai, and in this we look at 12 or more than 12 follicles, 2 to 9 millimeter in size, isn't it? And this recent clap if you feel happy, recent INI-CET MCQ, INI-CET MCQ ke insulin resistance. Okay, they had given these three criteria, and fourth was insulin resistance, and the question was which is not a part of Rotterdam criteria, and answer is insulin resistance. Yes, majority patients of PCOS have insulin resistance, but it is not in the criteria for Rotterdam. Okay, so Rotterdam का आपको 4 criteria देंगे, and which is not a part of Rotterdam. Okay, now please understand this. Whenever the patient has PCOS, anybody, what is, again one more last year MCQ, what is the initial management or what is the main treatment? Anybody, what is the initial management in PCOS? Can anybody tell me? So I'm discussing and then all the answers will be discussed together. Anybody? So please understand this, that always remember there is obesity majority and there is insulin resistance, and therefore no, wrong. The main treatment, yes, the main thing is always your lifestyle changes, lifestyle modification, weight loss, diet. This is for every patient. Diet, weight loss, exercise, all that we have to tell to all the patients of PCOS. Now, the next thing will depend on further what the patient wants. Are you understanding? Very good. So weight loss, diet, exercise, and what can help in this insulin resistance? Which drug can help me for insulin resistance? Metformin is helpful for insulin resistance. Now the treatment will depend on what the patient wants. Whether the patient is having infertility, she wants treatment for infertility, or she wants treatment for acne and hirsutism and irregular periods. Okay, now you classify the patients as what treatment does she want. Now can anybody tell me one word answer, why is there infertility? Infertility क्यों है पेशेंट में? इनफर्टिलिटी क्यों होता है पीसीओएस पेशेंट्स में? PCOS patients, why infertility? Why? Chalo, one word answer. Yes, very good, Ruchika, excellent. Sir, infertility is because of, very good, Pranav, Pratik, Nalin, all of you correct. Okay, and ovulation is the reason why the patient of PCOS has infertility. And many of you still have the wrong old kachra dustbin concept that we will give clomiphene citrate as the first drug of choice. Wrong. Please remove it. Clap if you have clap if you have learned something new on a Friday morning. Clomiphene citrate is no longer the drug of choice. Clomiphene citrate was the answer in 2015, 16, 17, 18. After 2018, it has been shown in studies that letrozole, clomiphene can of course be used, but letrozole is considered the first drug of choice for patients with an ovulatory infertility due to PCOS. Of course, because letrozole is giving better results. Okay. Clomiphene is still used and can be used as a second line treatment. And when all these oral medicines fail, तो क्या I will have to give still powerful injection. That is what basically what I want to do. I want the follicles to grow. Isn't it? In PCOS क्या हो रहा है? यहाँ छोटा follicles. Picture I am showing you. So I want the follicles to grow. So to make the follicle grow, I need to give them FSH. Very good. Either we will give them recombinant FSH or HMG. You can go to my actual classes and see the HMG कैसे आता है, क्या आता है. HMG is human menopausal gonadotropin from the urine of the postmenopausal lady. Is this understood to all of you? That's the last line. Okay. So now if you look at this question, यहाँ पे क्या है? यहाँ पे क्या है? Patient is married and anxious to conceive. मतलब she wants pregnancy, and all of you made a mistake in this MCQ, which will not be useful. Which will not be. Metformin useful? Yes. Clomiphene? Yes. Letrozole? Yes. OC pill is the answer over here. यहाँ पे OC pill. Is this understood? 10 thumbs up. Any of you got this wrong? Googly question. Which will not be useful at present. At present matlab at now. Okay, why? Because OC pill is for birth control. And where I will tell you in PCOS, अगर आप infertile patient को OC pill दोगे तो patient बोलेगा ये डॉक्टर पागल है, डॉक्टर पागल है क्यों? क्योंकि डॉक्टर I want babies and doctor is giving me birth control pill, तो काम नहीं होगा. Is this understood to all of you? OC pill not useful at present in this lady. I'm not saying not to give OC pill. Okay. But now suppose I have a patient who says, doctor, I am not married, or even if I am married, I don't want pregnancy right now. अभी मुझे बेबी नहीं चाहिए. Please give me treatment for acne, hirsutism, irregular periods. Then clap if you feel happy. Clap if you feel happy. Made for each other. Made for each other. PCO. उल्टा कर दो. Flip it. OCP. ठोको ताली. They are made for each other. Why OC pill? Why PCO? Polycystic ovary. Oral contraceptive pills. Those who are hearing this for the first time, ठोको ताली. Clap. Is it clear? Okay, sir, why? Because, sir, OC pills will give all the benefit. OC pills will make the cycles will become regular. Very good. OC pills say acne will become lesser. Hirsutism will become lesser. Okay. And also future risk of CA endometrium जो PCOS को होता है, that will also become lesser. So can you see the benefits of OC pills? Cycles become regular, acne, hirsutism become less, and therefore here I give OC pills. Is this clear to all of you? And please, you are not supposed to interchange treatment. In a patient of acne, hirsutism, don't give. Don't interchange the treatment. Are you understanding, my dear student? I've seen the infertile patient, don't give OC pill. And acne, hirsutism patient, don't give clomiphene and letrozole. Is this clear? You cannot interchange the treatment. Is it clear? And therefore, initial, yes. And to both of them, metformin can be added. Metformin I can give here also. Metformin I can give here also. So metformin lifestyle modification is understood for all. Lifestyle modification यहाँ पे भी करना है, यहाँ पे भी करना है. That is understood. Is it clear? So I come to the question. This was our first question. Reassurance. Second answer, OC pill not helpful at present. Now, here again PCOS. So PCOS, again all of you know PCOS is the diagnosis. Why? Because all of you know irregular periods, acne, hirsutism, obesity, and look at the FSH-LH ratio. PCOS ratio, this FSH is typically 1:3. Okay. Now, please understand this. So here OC pill out. Okay. Now, many of you old thinking clomiphene. No, clomiphene is not used. Now, when I have to choose between C and D, many of you marked C as the answer. Many of you marked C as the answer. Partly wrong, partly correct, but wrong over here. Why? Because please understand this. Okay, apart from letrozole, will I give metformin? 100%, because she is obese. Obesity, insulin resistance, so metformin has a role. And since they are married for 3 years, it is always better to evaluate the male partner also. And is this understood? Virgin MCQ. Those who are meeting me for the first time, Virgin MCQ is my specialty. MVP Virgin. M से मोस्ट इंपॉर्टेंट आपको कराता हूं. PYQ हो रहा है वर्जिन. Virgin MCQ matlab never asked before but will come in the future for sure. Okay, so here D is much better than C. Understood? Thoko tali. C is like partly correct, partly wrong. Yes, weight loss for metformin and weight loss diet modification and evaluate the male partner is a much complete rounded answer, perfect answer. Okay, is it clear? So no, there's no issue from my. Okay, is this understood? Can I get 10 thumbs up? And therefore D is much better than C. Don't only mark C. If D is not in the option, then letrozole is okay. Okay, yes. So D much better than C. Okay, yes. Moving on. Now this one, so this is absolutely crystal. Now this is what? Yes. Now here tell me the answer. 20-year-old lady hai. She wants treatment for hirsutism. Now here I will not give her clomiphene and letrozole. Here I will give for OC pills. And what is this cyproteron? They will teach you in dermatology also. Cyproteron is a part of OC pills only. It's a progesterone. All of you know OC pills में क्या होता है? Ethinyl estradiol plus progesterone. Now this progesterone could be different. It could be levonorgestrel, it could be desogestrel, it could be cyproteron and the newer one drosperinone. So ये दोनों जो है cyproteron का benefit क्या है? So cyproteron is a progesterone with a anti-androgenic property. Pharmacology concept. Yes, one concept. Yes, okay. Is it clear to all of you? Cyproteron is the anti-androgen. Okay, cyproteron is anti-androgen and one more anti-androgen, drosperinone also. Is this understood to all of you? So please understand this, both these. So that is better. Okay, cyproteron, drosperinone. Okay, so it's not one concept, but Niranjan, 10 concepts have been cleared. Rotterdam criteria we taught you. Lifestyle modification, 10 MCQs discussed with 2 MCQs. Okay. Cyproteron, drosperinone, both are progesterones. They are progesterones with a anti-androgenic property. Is this understood to all of you? So they are better for patients of PCOS. Is it crystal clear to all of you? And therefore here C is the answer. Clear? Yes. So here don't give letrozole. Here please don't give clomiphene. And drilling to kachra dustbin. Okay? Yes. Okay? Yes. Yeah, okay. Yes. Now, all are increased in PCOS except already we know insulin resistance is more, acne, hirsutism hai, testosterone is more, and LH I told you, FSH to LH. What is the normal ratio? 2:1 is considered normal. And in PCOS, the ratio gets inverted because LH is going to be higher and therefore I get the ratio as 1:2 or 1:3 or even 1:4 in PCOS because LH is going to increase. Okay, in PCOS. And the answer is progesterone. Why? Because the first rule, I start my lecture with this rule. What is the rule? Okay, sir, only if the female ovulates, only if there is ovulation, then the corpus luteum is formed and then the progesterone enters into the movie. Progesterone is secreted only after ovulation. So ovulation, corpus luteum, progesterone. So if I add the word no ovulation, no corpus luteum, no progesterone, and no ovulation matlab an ovulation. The commonest example is PCOS. If they ask you the most common example of an ovulation, they ask you PCOS. And therefore progesterone is going to be not increased, very low or absent because of an ovulation. Thokotali. Is this understood to all of you? Moving on. What is this Many of you marked HSG. No. What is this? Our famous Dance India dance. Anybody? Dance India dance is with which one? Okay, Dance India dance. What is Dance India dance? So dyspareunia, dysmenorrhea, painful period, painful sex, pain during intercourse, and infertility. This is classical features of endometriosis. And seeing is believing. Endometriosis में HSG not so much helpful. Yes, you might see tubal adhesions and block. Hysteroscopy no role. Why? I'll tell you hysteroscopy laparoscopy का क्या difference है. And sonography, yes, but sonography may see only the chocolate cyst and not other features. And another thing is retroverted uterus fixed. This is because of adhesions in the pouch of Douglas, okay, along with nodularity. Why adhesions? क्या होता है कि sir, normally the uterus is antiverted, but because of all the adhesions in the pelvis, because of all the bleeding, endometriosis, there's adhesions, and the uterus therefore becomes retroverted. Uterus becomes retroverted. And for your endometriosis, laparoscopy is the investigation of choice. Laparoscopy is not only for diagnosis, simultaneous treatment also I can do. Now, laparoscope मतलब क्या है, हिस्ट्रोस्कोप मतलब क्या है, स्टूडेंट को यहाँ से कंफ्यूजन होता है. Anybody, what is laparoscopy, what is hysteroscopy? So point number one, hysteroscopy is completely different. I will teach you today only. Hysteroscopy, I put the telescope through the cervix, through the cervix, into the through the vagina, into the cervix, and into the uterus. I put a telescope to see the cavity of the uterus. That's it. Only uterus cavity will be seen. Nothing else. I can only see the inside of the uterus. That is my hysteroscopy. Okay. That means if all of us are sitting in the classroom, very good, it's like a revision for all of you. If all of us are sitting inside the classroom, then I can see all of you. Okay, but from inside the classroom, can I see who is standing on the terrace of the building? No. How many cars are outside? No. So what is the difference? So laparoscope is the terrace view. When you go on the terrace, and laparoscope say you put in a telescope through the anterior abdominal wall. A telescope is put through the anterior abdominal wall to check, to see the pelvis, uterus, tubes and the ovary. Okay, but laparoscope cannot see inside. So मुझे स्टूडेंट्स बोलते हैं कि सर विच इज बेटर, लैप्रोस्कोप के हिस्ट्रोस्कोप? नो, इट्स लाइक आमिर खान, शाहरुख खान, सलमान खान, इज बेटर? नो, सब अपना अपना किंग है. इट डिपेंड्स ऑन द पैथोलॉजी. आई एम गोइंग टू गिव यू मेनी मोर एग्जांपल्स विद दिस इन सम टाइम. So now first tell me, can you tell me, laparoscope is the outside view and I'll tell you what all you can see. Now tell me, in endometriosis, tell me three features. Tell me just three. There are totally 5, 6. Tell me three features of endometriosis on laparoscopy. Chalo. Yes, yes, yes. Tell me three features of endometriosis on laparoscopy. What all will I see? Chalo, chalo, chalo. वेरी गुड यशिका, एक्सलेंट. और क्या है? और तीन चार, और तीन चार. हाँ, Lesion, very good Pranav. Okay, fruit salad, yes. So पहले आपको point number 1, this is the uterus, this is the uterosacral, this is the fallopian tube. Okay, this is how the actual laparoscopy looks. I'll show you the picture also. Okay, don't worry, all pictures are also coming. And this is the fallopian tube and this is the ovary. So point number 1 क्या दिखेगा? Yes sir, chocolate cyst. Chocolate cyst, I'll show you the picture. So it is called CC, I'm writing CC. Then it's going to be adhesions. Adhesion between the tube and the ovary. Adhesions दिखेगा. And then powder burn spots. जो गन पाउडर, गन शॉट, जो black powder burn spot, matchstick burn spots, then blueberry, blue lesion, red raspberry, purple raspberry, all fruit salad, blueberry, तो ऐसा blue color का lesion. तो ये सब my dear students can only be seen. Sonography will not see all this. Sonography will not see the adhesions and the blueberry and red and black. That's why sonography say better laparoscopy, and you can simultaneously treat it. You can break the adhesions and we can burn. ये सब जो है उसको हम जला डालते हैं, जला के राख कर दूंगा. Electrocoagulation. Is this understood? So blue color lesion you get, purple color lesion you get, yes, red color flame lesion, all these lesions you get, red, blue, black, purple. Okay, is this understood? ठोको ताली. And therefore laparoscopy से ही पता चलेगा. But laparoscopy cannot see inside. Okay, laparoscopy cannot see inside. Now all of you look on the board. All of you look on the board. Suppose there is inside the uterus, I'm teaching both the things together. Suppose inside the uterus there are intrauterine adhesions. इसको क्या बोलते हैं? Anybody? Very good. Okay. Anybody? If inside the uterus adhesions, इसको क्या बोलेंगे? Not these adhesions. These are pelvic. These are tubo-ovarian. The adhesions between tube and the ovary. ये intrauterine adhesions को क्या बोलते हैं? Okay. Asherman syndrome. Asherman syndrome is intrauterine adhesions. Or there could be very good septate uterus. Septum. There is a septum projecting inside the uterus. All that. Or there could be what, my dear student? Or there could be what? So एक हो गया आपका adhesions. Or there could be a endometrial polyp. Or there could be a submucosal fibroid. All these pathology, fibroid in the cavity, all this can only be picked up by hysteroscopy. Is this understood to all of you? Fibroid and polyp in the cavity. Okay, I'm writing submucosal fibroid. This is a polyp and simultaneously I can treat it. This fibroid polyp are going to cause menorrhagia and infertility also. Okay, so the answer over here, laparoscopy. And you can see picture abhi baki hai. All of you look on the board. This is the vanilla ice cream. This all you can see vanilla ice cream. You can see chocolate sauce, isn't it? Yes. So it's not vanilla ice cream, it is a chocolate cyst. Similarly, all of you, can you see this bluish nodule over here? Yes, you can see a bluish nodule. Clap if you feel happy. You can see all these adhesions. Okay, and again, if you zoom and see very clearly, you can also see the black color spots. Can you see all this blackish? See black spots here. Okay, black spots are there. That is that matchstick burnt spots or chocolate matchstick burnt spots or powder burnt appearance or whatever. Okay, so blue, red, blue, black, colorful, sub color yaad rakho. And this is the lap. Wherever you can see uterus, when you see the pelvis, this is the laparoscopy view. Okay, now what is this? Very important PYQ also. Patient is treated with infertility with ovulation induction and identify this picture. Now this picture is what? And this picture is what? Can anybody tell me what is the difference in both the pictures? Okay, yes. So please pay attention, all of you. Whenever they give you history of ovulation induction, specifically this FSH or HMG is used, and along with it, just a second, along with it, FSH, along with it, along with it, HCG. Okay, along with this FSH, when finally we give HCG as the final trigger, and along with this picture, they should also show you picture of actually ascites or free fluid in the pelvis. Now, what is this? Yes, very good, Ruchika, and all of you. Here, sir, the follicles are all big, big, big. Big matlab 18-20 millimeter. They are all coming in the center also, and along with it, they should tell you ascites also. Remember, ascites is a very important feature for OHSS. So it is ovarian hyperstimulation syndrome, PYQ. Please don't make a mistake. This is OHSS. Is it clear? Because you can see over here, all the follicles are big, big, big. See, this whole ovary itself is very, very big. Okay. And all the follicles are basically multiple big follicle. Okay. So all the follicles are big, big follicles. Big matlab 16, 18, 20 millimeter. Is it clear? And along with it, they should show you picture of ascites. Actually, if I am the examiner, I will give both the picture. In the exam, only this one picture had come, but actually they should tell you that there is presence of ascites also. Okay. Whereas, absolutely correct. Whereas you will, whereas if we get chota follicles arranged in the periphery, then that is the necklace pattern, and that is PCOS. And how many follicles? So can you see this? Yes. So this is your famous necklace of pearls. So one MCQ, two, three pictures. Okay. So you can see over here, all these are chota follicles. What is the size of this follicle? Anybody? What is the size of the follicle in PCOS? So this is PCOS, 12 or more than 12. What is the size of, chalo, tell me, size of the follicle? Yes, all the follicles will be 2 to 9 millimeter in size. Remember this, very important. 2 to 9 millimeter. Koi 2 ka hoga, koi 4 ka hoga. And I'm so happy. I am showing this picture since 2008. Last 20 years, I'm showing this picture to my student. This picture came for the first time in the INICET. This picture, this. Now tell me, this is laparoscopy view or hysteroscopy? Chalo, tell me. ये लैप है के हिस्ट्रो है? विच इज दिस व्यू, लैप्रोस्कोपी व्यू के हिस्ट्रोस्कोपी व्यू? चलो चलो चलो, ऑल दोज हैव अंडरस्टूड द कॉन्सेप्ट. ये टेरेस व्यू है कि इनसाइड द क्लासरूम व्यू है? यस, एक्सीलेंट. Sir, whenever I can see the uterus, ovary, this is a laparoscopy view. This we are seeing the uterus, pelvis, this is the pouch of Douglas, and here what are we seeing? Yes, this was asked in the INICT. Okay, the ovary is big and bulky. They had of course given the history also. So here this is a bulky ovary. Ovary is increased in size and volume. Bulky ovary of PCOS, increase in ovarian volume. Okay, bulky ovary, the volume is increase in volume of the ovary. Okay, yes, they are also called as oyster ovaries. Sometimes called as oyster ovary. Thoko tali, clap if you have learned something new. Okay, so laparoscopy view. This question has been asked already. This is a PYQ. This is a virgin MCQ for your FMG. Virginity broken in INICET. INICET, this question came. Okay, identify what is the ovary suggestion. There's given history of infertility, irregular periods, all that history will be given to you. Okay. So next, moving on. Chalo, now tell me the answer. Again, revision. Patient complains of septum in the uterus. Chalo, now no explanation. Fast. Already discussed. Midline, septum in the uterus. Septum in the uterus. Which instrument? Lapros. How many want to do A? How many want to do A? Kachra, dustbin. Gone. Clean, bold. Yes, perfectly correct, sir. Septum is, all of you know, sir, septum is inside the uterus. Septum is inside the uterus. It is understood like this, septum, and I will therefore do a hysteroscopy, and with hysteroscopy cut. That is called as hysteroscopic septal resection. Okay, you will go and cut the septum, also called as hysteroscopic septoplasty. Septoplasty you can say, or septum resection, or septal resection, whatever word you use. Sorry sir, laparoscopy no role. Laparotomy, laparoscopy का कुछ मतलब नहीं है. Okay, perfect. Okay, septum resection. Similarly, chalo, hysteroscopy is for all of the following except. Hysteroscopy is done for all of the following except. Okay, so I told you Asherman syndrome. Of course, we can do hysteroscopy. Then your menorrhagia patients, I told you infertility, the septum can cause infertility, and polyp and fibroid can cause menorrhagia. Adenomyosis, picture I'll show you today only. Adenomyosis is the answer. Why? Because anybody, what is adenomyosis? In adenomyosis, no, and B is not beta. Menorrhagia patient you do. Why? Because sir, polyp submucosal fibroid. Googly, huh? This is a virgin MCQ, clean bold. Many students clean bold. Tough MCQ. Yes. Anybody, what is adenomyosis? What is adenomyosis? Adenomyosis is, yes, but what is, yes, menorrhagia, dysmenorrhea, correct. Already you're telling me the symptoms, but adenomyosis, yes, salt and pepper, Venetian blind, picture I will show you. But adenomyosis, my dear student, is presence of endometrial glands within the myometrium. Okay, so we are going to get these glands. These are the endomet glands. These are the endometrium, or endometrium within the myometrium. Is it clear to all of you? And therefore ultrasonography is required for adenomyosis. It's the endometrial glands, and you see this as cystic spaces, hypoechoic, yes, along with globular uterus, asymmetrical enlarged uterus. Please go and check my this also in I'm going to tell you Insta every time putting the no. Have you seen that post on Insta where I've given all the ultrasonography features, the Musa criteria? Okay, so adenomyosis will require ultrasonography. And can anybody tell me what's the sign? What's that appearance? Venetian blind appearance. Okay, your radiology teacher must have taught you Venetian blind. I'm showing you the picture also. Okay, so adenomyosis may, sir, hysteroscopy has got no role, because hysteroscopy is only for the cavity of the uterus. Okay, and here the cavity में normal होगा, hysteroscopy करके कोई मतलब नहीं है. Endometrial glands within the myometry. Okay, yes. Moving on. Now, what is this test? Chalo. Now tell me, what is this? What are we seeing over here? Again, this question has been come. What is the dye? Okay, so in the beginning, some student told me, sir, show me images. All images I'll try to cover. Okay, yes. Now again, this is a laparoscopy. Why? So this is the uterus. This is the pouch of Douglas. This is the ovary. This is the fallopian tube. So this is not a hysteroscopy. A hysteroscopy nahi hai. This is not a tubal ligation. This is not a sonography. This is laparoscope. See again, B wrong. It's not hysteroscopy. ये blue देख के clean bold. Dandy गुल. This is not hysteroscopy. हिस्ट्रोस्कोपी के साथ मिथिलीन ब्लू करते ही नहीं है. Yes, this is laparoscopy chromopertubation. Chromopertubation is done with methylene blue dye. And what is this test for? Sir, this is the best investigation for tubal patency. Is it understood to all of you? Gold standard, because with my own eyes, but it's a surgery. Okay, if they tell you best investigation, confirmatory, gold, all these words are used, confirmatory, gold standard, best investigation for tubal patency, laparoscopy chromopertubation. What is done? Sir, we push the dye into the cervix. Okay, we push the dye into the cervix. Which dye? Through the cervix. Through the cervix, I put the methylene blue dye. Okay, is this understood to all of you? And suppose and I am seeing it through telescope. So दो चीज करने का, डाई को डालते हैं सर्विक्स में से, डाई को डालते, clap those who are hearing it for the first time. So dye you put through the cervix and then telescope ready, and if the tubes are patent, this blue color will come from here, and you will get the spill of the dye, and everybody start jumping in the blue hai pani, so all blue you see. Okay, blue hai pani. Okay, so this is called as laparoscopy chromopertubation. This is a laparoscopy view, and you can see this blue color dye. This is called as the spill of the dye, thokotali. Spill of the dye. It is done with methylene blue dye. It tells you that the tube is patency. Yes, best investigation for tubal patency. Yes, so please just directly methylene blue padke, isn't it a clean bold? Yes, so this is not hysteroscopy, this is laparoscopy view, and that is for this 1 second. So just to show you this, yes, now this just 1 second. Now tell me all of you, all of the following can be diagnosed by laparoscopy except, chalo, tell me this so that I know it is crystal clear. Yes, perfectly correct, sir. बाइकॉर्नुवेट मतलब टू सेपरेट हॉर्न्स अगर होगा तो लैप्रोस्कोप से दिखेगा. If it is only a one-sided horn like this, unicornuate, that also, and of course endometriosis, I told you everything, chocolate say study them. Septate uterus, or septate uterus is a PYQ, clap. Septate uterus requires hysteroscopy. This is, my dear student, 4 to, you cannot even imagine, in 1 hour 3 to 4 marks are in your pocket, because in the exam all this Mullerian, hysteroscopy, laparoscopy, PCOS, endometrial, all 2 questions are going to come. Okay, so septate uterus requires hysteroscopy, rest all with laparoscopy. I can find out bicornuate, unicornuate, endometriosis, all that I can find out. Isn't it, all of you? And this is, again they will give you here, right, this is a HSG, hysterosalpingography, again a virgin image. Okay, so all of you can look on the board. If I slightly zoom also, okay, so here you can see, okay sir, I can see a triangle cavity, and I can see the left tube very well. All of you follow this left tube, I can see very well, spill is there, but right sided there is no dye going over here, isn't it? So this is not a normal HSG, this is not a bilateral block, this is not a left sided block, this is right sided cornual block, and left normal tube. Of course, right left marking. Again, this is a virgin MCQ. Bilateral cornual block में कैसे दिखेगा? Sir, only the uterus is seen, and then there is block at the cornu, so you will not see any tube. So that is your bilateral block. यहाँ पे right sided I am not seeing. Can you see this? I am not seeing anything on the right side. Okay, but left tube is very clearly seen with the spill also. इसको बोलते हैं spill. So left tube is normal. ठोको ताली. Tough है, but my students will be able to get it. Virgin MCQ. Okay, so ये हो गया आपका chromoperturbation, HSG all discussed, and now match the column. चलो, now all of you should get it correct. Match the column. This is the condition and this is the preferred investigation. Now for endometriosis, how many are saying hysteroscopy? How many are saying 1A, 1A, 1A? Wrong, wrong. Kachra dustbin. Okay, endometriosis के साथ laparoscopy. 1B. So 1B, 1B. That's why two option out. See, easy. And Asherman syndrome के लिए intrauterine adhesions 2A, 2A, 2A. Very good. Torsion. Previous year question. When there is a torsion, I have to go for color Doppler. Why? Because sir, whenever there is a ovarian mass and it has a pedicle and it twists, तो जब torsion होता है, the blood supply gets occluded. The blood supply will get occluded because of the mechanical twist. And whenever I want to do anything with the blood supply, I have to look at color Doppler. In Monday class, I will also show you that ring of fire on ectopic. That's also color Doppler. And fibroids के लिए normal ultrasonography is okay. Color Doppler is a part of USG only. Color Doppler ultrasonography. So 3C है, 3C है, 4D है. Do you agree with me? C is the answer. Okay. And one more MCQ. Can you please tell me which ovarian tumor maximum risk of torsion? Yes. So remember, for torsion, color Doppler is the investigation of choice. Okay. So for torsion, whenever it's a torsion, color Doppler is the investigation of choice. And they will tell you one more thing. Severe acute abdomen. Acute abdomen. Patient will present with acute abdomen and vomiting. Please keep in mind, clinical case. And out of all the thing, dermoid. Dermoid has got a maximum chance of torsion. Okay, is this understood to all of you? So whenever the twisting happens, the blood supply gets occluded. It's like a twist. Okay, is this understood to all of you? This we have discussed. And now this is just to show you, we are seeing the cavity of the uterus. So this is the hysteroscopy, the normal. This is, see the cavity, it is clean. Cavity is normal. So only inside view you are seeing. This is the inside view. That is hysteroscopy. And this is the terrace view or the outside view. You are going on the terrace and I can see the tell me now what is, you are seeing the uterus, fallopian tube, ovary, pelvis, pouch of Douglas, all that जैसा actual anatomy में दिखता है. तो this is the laparoscopy. Students को ये भी basic नहीं होता है. Clap if you have learned something new. All those who are hearing me for the first time, because many students don't understand, sir, what is hysteroscopy, what is laparoscopy. Now all of you have become experts. So hysteroscopy I use for inside the uterus, like if there is example Asherman, polyp and septum. Okay, and laparoscope is used for chromoperturbation, endometriosis, all that terrace view where you can see ovary, any ovarian tumor. I can check the tubal patency, all that I can check. Very good, isn't it? Moving on to the next set. Yes. Now again, a image, very important question that has been asked in the past. Yes, corneal ends can be seen, correct, but that's only the corneal end, not the whole tube. Okay, whole tube, if I want to see, whole tube can only be seen with laparoscopy. Whole tube, so you can see the whole tube, you can see the whole tube till the end. Okay. Yes, this is a special instrument, hardly ever we used. This is a Very's needle, where we put this needle into the abdomen before laparoscopy. Before laparoscopy, because for laparoscopy I have to put a gas. So the gas is connected over here. And what is the gas? Anybody, which gas we use? Carbon dioxide. You have to put a gas in the abdomen. This is called as pneumoperitoneum. You are creating a, so that you are creating a space. You are creating a space. Okay. Yes. Okay. Pneumoperitoneum, gas, laparoscopy, and okay. Again, remember one more MCQ. You try to maintain the pressure intra-abdominal 10 to 15 millimeters of mercury. Because if you put too much gas, the pressure will rise. There can be problem. Okay. So try to maintain the intra-abdominal pressure during laparoscopy surgery. Again, a PYQ. 10 so you are not even kitne sara in 1 hour we are discussing thousands of MCQ. Yes. Now this is a HSG. This is a difficult picture, but you will tell me which is septate, which is bicornuate. Yes. So now please understand this, that this is HSG is not confirmatorily will require histolaparoscopy only, but HSG can tell us what you are supposed to do. The logic is this: कि septum is inside, isn't it? Septum is going to come inside. Septum is going to protrude inside, and therefore, sir, agar septum hai, and if I put a dye, if I put a dye, I'm just telling some another color dye, suppose this, if I put a dye, what will happen? The dye will go here, dye will go here, and what picture I am to get is going to look like the first picture. All this is the dye, okay, on HSG. So यहाँ पे क्या होगा? We will see like a two cavities. We are going to see two cavities, but when I will measure them, there is going to be a acute angle between the two. And what is my bicornuate uterus? Say bicornuate are two horns wide apart. एक horn ऐसा है, एक horn ऐसा है. And therefore here when I measure it, we are going to get a obtuse angle. So difficult, but yes, this has has come in the exam. Here I repeat, we are seeing a acute angle, and therefore I will call this as yes difficult. sir exam में कैसे measure करेंगे ये वो सब agreed है, but difficult. And this is the two horns wide apart, so this is bicornuate thokotali. Okay, of course, to confirm you require a hystrolaparoscopy. Is this understood to all of you? Yes, and lastly, this is a PYQ which has been asked. Now, this is a complete duplication. This is not bicornuate. We are seeing two horns, but also two cervix. So, on per speculum, you will see one cervix and another cervix. Two cervix are seen. Therefore, it's a complete duplication. And this is, yes, didelphys. Okay, uterus didelphys. So remember this complete duplication. If the same septum, agar ye septum keeps on going down, 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 down. Okay, it's like this. If you have a complete septum going all the way till the down, and we are seeing two separate. Bicornuate mein cervix will be one. Bicornuate mein cervix will be one, two separate horns. Okay, that is why see in bicornuate only one cervix. Only one cervix, two horns. So bicornuate mein cervix is only one, but there are two horns. Okay, is this clear? Didelphys mein there are two cervix. Again, very important MCQ. Okay, now last part. Chalo, again, absolutely concept based. Match the column, match the profile of a lady with amenorrhea, and what are the hormonal levels. Anybody, what is Sheehan's syndrome? What is Sheehan's syndrome? Yeah, twins for one horn possible. Yeah, beta. Yes. Yes. Now, what is Sheehan's syndrome? Now, please understand this. For this concept, you should know master and servant. Pituitary is the master and ovary is the servant. Thokotali, if you like this concept. Pituitary is the master and ovary is the servant. Now, if your servant is working normally, the master is happy. At your home, common sense, at your home, if your servant does not work and servant is not working, what will the master do? Master will shout more loudly. कि बाबा काम करो काम करो काम करो work. Well, like if you're not studying, doctor will say, your teacher says, well, study. Yes or no? If your servant at home is not working, your parents will shout work. Is it clear? So remember this, okay, as the ovarian function goes down, the master function will go up. Okay, so when there is ovarian insufficiency, that means the patient is not working, the ovary is not working properly, or when the patient is reaching menopause, or when finally menopause has arrived. Menopause matlab ovarian function stop. So when the ovarian function will stop, the estrogen will be low, but FSH and LH are going to be very high, isn't it? D4, सबके साथ D4 है, that makes okay. Is it clear? So whenever there is ovarian function permanently stop, the FS, and therefore there is an MCQ. FSH is highest where? FSH is highest in menopause. Okay, FSH highest in menopausal lady. Why? Because our FSH is coming from the pituitary. Pituitary is the master, and when ovarian function stop matlab menopause. Now, agar pituitary itself is not working, yes, Sheehan syndrome is postpartum pituitary necrosis, isn't it? Pituitary gland is only not working. So if the pituitary gland is not working, FSH-LH will be low and even estrogen will be low. So A1, 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 ये दोनों गया. नाउ कॉमन सेंस, आशरमैन. आशरमैन में फॉल्ट कहाँ पे है? कहाँ पे भी नहीं है सर. आशरमैन तो इज इन द यूट्रस. Asherman, I told you, because you all of you know, because of repeated curettage. So sir, Asherman में the fault is in the uterus. So master also normal and ovary also normal. Pituitary will also be normal, ovary will also be normal in Asherman, and therefore Asherman all normal. B2, B2, and you have the answer. Okay, is this, and PCOS we just now told you high LH. PCOS I told you LH is high, FSH is normal, and estrogen is normal too on the higher side. C3. Is this understood to all of you? This is the tough MCQ, my dear student. If you are able to answer this question, your concepts are crystal clear. Only those. That's why my hashtag crystal clear concepts. Okay, जिसका कॉन्सेप्ट क्लियर है उसी को ये MCQ करेक्ट होगा. मगअप करके कितना भी लेक्चर अटेंड करो, कितना भी बुक्स पढ़ो, इफ योर कॉन्सेप्ट इज नॉट क्लियर, यू कांट गेट दिस MCQ करेक्ट. यस और नो? यस. सो पिट्यूटरी गया तो FSH गॉन, LH गॉन, estrogen also will be low. Okay, and ovarian insufficiency में, because ovarian insufficiency estrogen will be low but FSH LH both are very high. Okay, yes. Now new definition, which of the following indicates primary amenorrhea? चलो, प्राइमरी अमेनोरिया का डेफिन ABCD. सुपर. यस. Okay, yes, moving on, moving on. So like again 4 or 5 MCQs and then the answer. Next, very important, short. 16-year-old primary amenorrhea. Breast well developed, absence of axillary and pubic hair, lump fed in one region, USG absent uterus. Okay, moving on, match the column, very important. नो, चिंटू ओवरी नहीं है, जिनमें थोड़ा कंफ्यूज आप कर रहे हो. ओके, चिंटू यूट्रस आता है, वो हम डिस्कस करेंगे किस में आता है. ओके, यस. Very good. Okay. Yes. Moving on. Very simple. Please don't make a mistake. Many times this has asked in the exam and all of you should get correct. What is this condition? If the patient has primary amenorrhea and cyclical abdominal pain. ये डॉक्टर पीरियड है लेकिन बाहर नहीं आ रहा है. Cryptomenoria. This is your cryptomenoria, hidden. Okay. Yes. Okay, so all of you please pay attention. Please pay attention. For primary amenorrhea, the olden criteria, the old criteria was 14 years and 16 years. Is this understood to all of you? That is now old, that is outdated, kachra dustbin. Don't follow that. We follow the new criteria, and in new criteria, the age has been decreased by one year. The 14 has now become 13 years and 16 has now become 15 years. But why two definitions are there? Because it will depend on secondary sexual characters, SSC, secondary sexual characters मतलब presence of breast development and axillary and pubic hair. So common sense, if secondary sexual characters are absent, secondary sexual characters are absent by the age of 13, then there is no point waiting, and even at 13 you will make the diagnosis. But sir, suppose I see a girl in the OPD and breast development is present, very good, axillary pubic hair is present, then you can wait for 2 years. Okay sir, breast start ho gaya, axillary pubic hair start, let us wait, and then I can wait till 15 years, and even by 15, if there is no, my mic is all okay. Hello, mic is all okay. Okay, so is it all clear? Yes. So please keep in mind when you get this question, first of all, 14 is out. 14 is out because that is the old criteria. 13-year-old, no menses with breast development nahi. Here I can wait. We can wait. Okay, we can wait. Why we can wait? Because there is breast development. And this is the answer. 13-year-old, no menses without breast development. Is this understood to all of you? Yes. Okay. So 13-year-old, no menses without breast development is the answer. Okay, clear now. Please understand. So I hope all of you have got it correct options. Can I move, can I proceed further? Can I get 5 thumbs up? Then I'll proceed further. 5 thumbs up, then I'll proceed further. 10-15 minutes, then we'll go on. Yes, perfect. So here this patient, 13-year-old, you can wait, you will wait till 15 years. You will wait till 15 years. And still, if the menses are not starting, then you tell her as primary. Now, whenever we get primary amenorrhea and absent uterus, in the whole of gynecology, if you have primary amenorrhea plus absent uterus, can anybody tell me what are the only two possibilities? What are the only two possibilities? Primary amenorrhea, absent uterus, the only two possibilities are RMKH, Rokitansky-Meyer, also called as Mullerian agenesis, or your androgen insensitivity syndrome, also called as testicular feminization syndrome. Please by heart, this is a 7-star slide. Those students who do not know this concept, I request you to go back and see the actual primary amenorrhea ka 35-40 minutes ka video to get a complete crystal clear concept, because this is a 7-star thing. Okay, now the first important difference is that when you look at the karyotype, this is XX and this is XY. The next important difference is that there is Mullerian agenesis. So Mullerian duct like uterus, fallopian tube is absent, but ovary is perfectly normal. The ovary is normal. Ovary is normal. Here you get the gonads as testes, but they are undescended. Therefore, they are in the inguinal area. And the most important clincher in the question paper, you will look at the axillary and pubic hair. And here, my dear student, the axillary and pubic hair here is present. But here androgen insensitivity है, axillary and pubic hair absent or sparse. And therefore all of you look on the board. When I have primary amenorrhea, absent uterus, only keep these two things in mind. Turner syndrome is not absent uterus. Is it clear? Sir, in Turner syndrome, the uterus is present. But Turner syndrome में sir, uterus चिंटू होता है, छोटा होता है. Why? Because there is no estrogen. So Turner syndrome uterus is present, but it is a hypoplastic. Okay, hypoplastic uterus, but it is uterus is present. Okay, and here we have got very good absence of axillary pubic hair, and therefore androgen insensitivity is the answer. And what is it? Lump in the inguinal region? Anybody? What is the lump in the inguinal area? What is the lump in the inguinal area? Lump in the inguinal area. Just a second, all of you. Yes, the lump in the inguinal area is the undescended testes, all of you. And therefore the answer is androgen. Now, if I make a change, all of you look on the board. If I just change the question, clap if you feel happy. एक के साथ दो MCQ cover करेंगे. Suppose this lump in the inguinal area हटा दिया. Lump in the inguinal area is removed, and instead of this absence, they will write primary amenorrhea, breast well developed, and axillary and pubic hair present. Axillary and pubic hair present. Now, what is the answer, all of you? Yes, so now the answer will become RMKH. Koko Tali. Clap, clap, clap. Is it clear? We'll come back to the original thing. This is your absence of axillary and pubic hair. Lump felt is the this, and this is androgen insensitivity. Is this understood to all of you? Yes. Okay, Turner syndrome में uterus is hypoplastic, but present. And this all of you know. Okay, all of you know Turner syndrome is 45XO. Already told you 1A, 1A. RMKH I told you. Okay, uh, RMKH, which I told you, is your 46XX, and AIS is actually a boy. Okay, now just check. I think okay, and AIS is 3B, 3B, and Klinefelter is 47 XXY. The voice I don't know, but everything is perfect from my side. I don't know why there's some issue with the app, or I don't know. Okay, now is it all clear? Yes. So it is not 2B. It is not 2B because yes. So the answer is yes. So what's the answer? What's the final answer? 1A, 1A, 3B, 3B, 2C, and 4B. Perfect. Yes. So this is your answer. And this all of you should know. This is imperforate hymen. Okay, I'm sure all of you have got it correct. 2-3 times it has come. Bluish purplish hymen, tense bulging hymen. Okay, tense bulging hymen. Okay, bulging hymen and bluish purplish hymen. And what is the treatment? Anybody? What is the treatment? Yes, the treatment is cruciate incision. Cruciate incision. Perfect. Cruciate incision. Okay, is it clear to all of you? So please keep in mind. And why do we get cyclical abdominal pain? Because like every time, sir, the menses start, but the menses is not able to come out. Cryptomenorrhea or hidden menses. Okay, and they can get urine retention, very important, because the hematocolpos, it can press the bladder, and therefore they have urinary retention also. So please keep this in mind. That's an important MCQ, and they will present to us with primary amenorrhea. Even your transverse, not longitudinal blood can come out. Even transverse vaginal septum can also have this kind of a presentation. But here, because of the picture, we are going with the answer as imperforate hymen. Is this understood to all of you? So moving on, yeah. Okay, moving on to the next MCQ. Before we proceed further, requesting all of you, my dear students, to quickly just take 2 seconds, take 5 seconds, and please start following me on Instagram every day. So many, every day, so many questions, excellent reels, lots of MCQ discussion, only academic content, no time pass. I don't do any time pass on Insta. Only academic content, only OBGY MCQs, OBGY post, everything superb information you will get. So please start following me on Insta right away. And yes, those are already done, that's great. And also please subscribe to the YouTube channel. Yesterday only I have put all of you, I want you to go and see on this YouTube. I will post the video also, the last 35 day strategy. Okay, last 35 day strategy video I have put. What will you do, how many grand tests to give, how to revise OBGY, which other subjects to skip, all that, which subject I can do shortcut, all that I have told you. Okay, so please take 30 seconds, and those who haven't subscribed to the YouTube channel, yes, I know most of you already done. So just, and I'll also post the video, and I'll also post this, and on Telegram also you can join. So just this YouTube video is very important. I'll again post it after the content is over, after the class is over. Okay, moving on to the next thing. Category 4 for IUCD is, anybody, what's the meaning of category 4? Yeah, thank you. Category 4 for IUCD. Okay, because many today I think almost 50 students have joined the group today only, this Telegram group. Yes. Anybody, what is the category 4 for IUCD? So we'll discuss that, like again 4 to 5 questions. Picture I'm showing you, don't worry. Okay. All next MCQ. Okay, next MCQ. Para 1 living one property inserted 2 years back. Property threads are not seen. Property in the abdominal cavity. Method of removal is. नेक्स्ट क्वेश्चन वेरी लॉन्ग इज व्हेन सच क्वेश्चन कम स्टूडेंट का फट जाता है, ध्यान से सुनेंगे. पेशेंट हैज अ प्रेगनेंसी ऑफ 10 वीक्स confirm with the IUCD in place, मतलब pregnancy and property together. Property, I'll explain to you this picture, this, and there is a desire to continue the pregnancy, and we can see the IUD ka thread protruding from the os. What is the best thing to be done? Okay, all this scenario we're discussing. Next, category 4 for occipils is. So we are giving you like a test. We are giving you 5 to 6 questions first, then we are discussing all. Occipil reduces all except. Occipil reduces all except. Is it clear? A, B, C, D, all except. All of the following are LARC. Very, very hot word. What is LARC? All I like long acting reversible contraception. Except. All of the following can be used as emergency contraception except. Very important, again 5 star. Patient with 45 days wants MPP. Which of the following regime will you choose? A, B, C, D. Again, clean bold. Okay, yes, okay. This we come back all in 1 minute. 1 second. We come back. Huh? This I want, and then this. Okay, yes. Next to this one. I'm showing you. Don't worry. Okay. Patient, very important. Again, very important. 22 weeks pregnant lady requesting for MTP according to the latest MTP Act. and outdated, but again a PYQ, identify this contraceptive device. Okay, so we're discussing all. Quickly get ready. Okay, so now all of you quickly pay attention. Let us go on to discuss this very, very important topic. Category 4 is a fancy word. Category 4 is a new word for absolute contraindication. Okay, is this understood to all of you? Category 4 is a WHO category, and WHO category means that for this patient, the IUCD is absolutely contraindicated. Heart disease patients, I will avoid a copper T definitely, but I can. It is a relative contraindication. Similarly, those patients who are nulliparous also we prefer other methods, and menorrhagia patients also we avoid copper wala, but Mirena can be put, but overall menorrhagia is a relative for copper. Acute PID is the answer. If there's acute pelvic inflammatory disease, any active infection like puerperal sepsis, septic abortion, sepsis, infection, then I cannot put a copper T. And very quickly, I want all of you to give me four more. Can you give me four more absolute contraindication? Can anybody tell me? So one is acute PID, second is of course pregnancy, third is undiagnosed vaginal bleeding, suspected pregnancy, undiagnosed bleeding, all this. And very, very important, all of you look on the board, distorted cavity like this. If there's a uterine anomaly, two horns, how will I put a copper T? How can I put, there's one horn here, one horn here. Okay, yes. Similarly, very good. Your cervical cancer, endometrial cancer, distorted cavity because of either fibroid or uterine anomaly. Very good. And lastly, my dear student, PYQ, after vesicular mole. After I do suction evacuation, after vesicular mole, anybody why? After vesicular mole evacuation also I avoid a copper T. Why? After vesicular mole, the uterus is very, very soft and there is a risk of perforation. Is this understood to all of you? So after vesicular mole evacuation also because of risk of perforation. Okay, is this understood to all of you? So this is extremely important. Now here remember one thing, that the copper T is inserted, the copper T can get misplaced, you do USG, and copper T is in the abdominal cavity. So very simple. If it's in the abdominal cavity, how many want to do hysteroscopy? Wrong. Because copper T, look over here my dear student, this is the scenario. Yes sir, this is the uterus, this is the uterus, and the copper T has come over here. If they tell you copper T is partly or completely in the abdominal cavity, can anybody tell me? Can anybody tell me why will I not wait and watch? Why can I never wait and watch? Because, sir, this is a foreign body and there could be adhesions around this foreign body in the abdominal cavity. and intestinal obstruction can take place. Is this understood to all of you? And all of you know, putting in a telescope inside the cavity has got no role because copper T is outside, and therefore here we will have to put in a telescope from above, laparoscopy, or if not even laparotomy will have to be done. Can I get 10 thumbs up? Then I'll proceed further. सबको समझ में आ गया? If the question over here, yes, the uterus perforated and it's in the abdominal cavity, immediately removal. Very good. Laparoscopy. But if the question is, all of you look on the board, if the question is that, sir, I have done the ultrasonography and the copper T threads are only curled up and copper T is within the uterus and only the threads have curled up. Now I can wait and watch, and now whenever this is copper T is inside the uterus only, inside the uterus, then you can wait and watch also, and then whenever you want to remove, then we might think of a hysteroscopic removal. Is this understood to all of you? Yes, then you can wait and watch. Perfectly correct. We can wait and watch if it's inside. Yes, here you can wait. But then whenever removal, we'll prefer a hysteroscopic. Perfect, perfect. Okay, all of, is this understood? So all this kind of it. Now, this is very important question. Here kya hai? Okay, sir, whenever there, what is this big question? Okay, sir, there is a 10 weeks pregnancy and patient wants to continue the pregnancy. Okay, patient wants MTP, we can say MTP. But, and the copper T threads are coming out from the os and there is a pregnancy with the IUD in place. So here what has happened, my dear student? Okay, there is a pregnancy also which is growing. Okay, there's a gestational sac and there's a baby inside, whatever, and there is growing, and there is also a copper T on one side. That is the whole question. Copper T failure. Basically copper T can fail. Okay, and threads are visible. Okay, now point number one, thing should be very clear, that this copper T which is there, this copper T will not cause, yeah, first you rule out ectopic. Very good, Richika, excellent. You have to rule out ectopic whenever the patient conceives with copper T failure, but here they've already said it's a intrauterine pregnancy. So you have done a ultrasonography and we have made sure that there is no ectopic. The take home message is that this copper T will not cause any malformation. It will not cause any anomaly in the baby. Okay, तो just because अगर copper T है बेबी को हार्ट डिफेक्ट ब्रेन डिफेक्ट, copper T बाहर है, copper T is outside the gestational sac, copper T is not coming in contact with the baby, so copper T will not cause any anomaly in the baby. Is it clear? So this option B is wrong. Remove IUD to decrease the risk of malformation. Malformation है ही नहीं. Okay, and terminate the pregnancy because of risk of malformation, again out. Is it clear? One concept, two option out. It's a malformation is not there. Now, whenever the threads are visible, the first step is you will try to remove. One or two attempts may be made to try to remove to decrease the risk of infection and abortion, which is the answer over here. Remove the IUD to decrease the risk of infection. C, you will try first. C, you will try first, and afterwards in one or two try to remove first. First you try to remove. If you are not able to remove, then it is okay. You can leave the copper T in place. Nothing to worry. Pregnancy will grow. Baby will also keep on growing. And copper T कब बाहर आएगा? Baby जब बाहर आएगा. Baby bahar aayega. Show me that photo. It is circulating the world. Baby will come out with the copper T एंड बेबी का पाम आपको ओपन करेगा तो बेबी का हाथ के अंदर कॉपर टी आपको मिलेगा। नो, ऐसा नहीं होता है, बेबी के हाथ में कॉपर टी नहीं मिलेगा basically. And doctor will smile, baby will smile, see doctor, you put the copper tea, still I grow. Okay, no, it's not like that. But what will happen, don't worry, the baby will come out, the placenta will come out, yes, and post placenta the copper tea will come out, because copper tea will not be in contact. Post placenta the copper tea will come out, or you remove it. Okay, so point number one. Yeah, you one or two means what? Yeah, remove the IUD. How much try is up to you, na? You want to put one try, two try, 10 try. So remove the IUD. So there's no rule. They say that one or two attempts should be made. So remove the IUD is always the first answer. You are trying to remove it. That is the best, the next, the most appropriate or the best action. And if you are not able to remove it, then leave the IUD in place without any other treatment. Okay, so C is much better than A. First is always try to remove. If you are not able to remove, then there is no other option, you will have to wait. Okay, post placenta the copper will come out. Yes, perfect. Okay, is it clear to all of you? So please don't say okay sir, baby will come out. There's a image on the WhatsApp circulating. If anybody can circulate, you will post it now. You can put that the baby will come out and inside the baby's hand there's a copper T. No, like that does not happen. Okay. Yes. Now all of you know category 4 means what? Absolute contraindication. Now for OC pills, again for smoking patients is a relative contraindication. Age more than 35 also relative. And copper से thread not visible, then wait and watch. साहू राज फिर wait ही करना पड़ेगा ना. Yes, copper thread not visible, you'll have to wait. Just wait. Okay. Liver disease, because OC pills are metabolized in the liver, and therefore liver disease I will not give. And what are the other things? 2-3 more. Again undiagnosed bleeding, again pregnancy is understood. Breastfeeding, lactating mother, breastfeeding, breast cancer. If the patient has even past history of breast cancer, breastfeeding, lactating mother, and what more dangerous? Yes, DVT, thrombosis, stroke, Apla syndrome, all these cases, here even heart disease, all this is absolute so whole list is given in my lectures also, in the book also. Okay, keep this in mind, but mainly 4 4 active liver disease, breastfeeding, breast cancer, heart disease, DVT, Apla syndrome, thrombophilia, all this, and diabetic vasculopathy. Okay, diabetes vasculopathy. That means diabetic retinopathy, diabetic nephropathy, that means severe diabetes. Okay, severe. All these are absolute contraindication. Now, all of you know OC pills ka benefits. Already I told you ovarian cyst will become less, menorrhagia will become less, PMS will become less, PCOS में benefit होगा, acne will become less, hirsutism will become less. And which cancer? Can anybody tell me which cancers will become less with OC pills? CEO, Strocothali, colon, endometrium, and ovarian cancer. CEO. Okay, CEO will become less. But the cancer which slightly increase, we have to keep in mind, breast cancer slightly. Okay, don't panic. Cervical cancer and mainly this all hepatic adenoma is the answer. Hepatic adenoma is going to increase with your OC pills. Okay, now please understand this. LARC का मतलब क्या है? Very hot word. LARC में you have to remember triple I. What is the meaning of LARC? Long acting and reversible tubal ligation, whereas tubal ligation is a permanent method. Yes, you can reverse it, but that is only in special circum. It's a surgery. So I just cannot say I will do your tubal ligation. I do it only if it's family complete. And I can say कि जब ये फिर से बच्चा चाहिए हम ऑपरेशन खोल देंगे. No. So tubal ligation is a permanent method, and reversal is only done if in exceptional condition like husband dies or wife remarries or the children die, all that. So triple I क्या है? LARC, long acting reversible contraception. The definition when the frequency of administration is more than once a month. Okay, means I need to use it more than once a month. Okay, that's it. So OC pills is not LARC because OC pill patient has to take daily. Okay, similarly remember OC pill, OC pill, OC pills, POP pills, all this patient has to take daily, isn't it? So it is not LARC, they are not LARC. Okay, सो लार्क में क्या आता है, प्लीज कीप इन माइंड, लार्क में आएगा ट्रिपल आई, आई आई आई, आई में एक है IUCD स्पेसर 2 years 3 years, implants, and lastly which injection आपका DMPA, डेपो मेट्रॉक्स, बिकॉज 3 monthly इंजेक्शन. सो इट्स नॉट सो लॉन्ग, इतना ज्यादा लंबा नहीं है. इट्स अ 3 monthly इंजेक्शन, it's a 3 monthly injection, depo metroxyprogesterone acetate, but it's still, and all of you know IUCD and implants, so you can use it for 3 to 5 years and even 10 years, all that. Okay, yes. So implanon, IUCD, LNG, IUD, all of them come under your, and even injection. Okay, OC pills, POP is not large because they have to be taken daily. Okay, all are used for emergency contraception except, now here you should know my dear student, LNG 1.5 is what? famous brand name. आपने कभी ना कभी सुना होगा, केमिस्ट में जाके देखा होगा, वार्ड में देखा होगा, यूज किया होगा. आई पिल, one of, it's the more, if they ask you most common used, most common, if they use most common used emergency contraception. Okay, yes. Then IUCD can also be used up to 5 days, and latest, this is recent, ulipristal is what? Selective progesterone receptor modulator, absolutely new. Ulipristal क्या dose है? Anybody dose? Not wanted. Sahu Rajesh, not wanted, unwanted. Okay, the answer is ulipristal for emergency contraception is a recent advances, 30 milligram single dose, 30 milligram stat single dose. Answer is misoprostol. Misoprostol is not emergency contraception. Misoprostol is for MTP. When the pregnancy is confirmed, emergency contraception is after rape, after sexual intercourse, unprotected sex, when the condom ruptures or tears. Okay, ulipristal, please all of you will keep in mind the dose, 30 milligram single dose up to 5 days. Okay, this can be given up to 5 days. Is it clear? Yes. And this also, many of you told me option A and clean bold. Why is option A wrong? Why is option A wrong for MTP, medical MTP? Because my dear student, ध्यान से देखोगे, clean bold, googly question. Because the combi kit, this packet picture can come, 4 tablets. What is the single tablet? कैसे याद रखना है? Remember MIFI. Clap if you are happy and hearing me for the first time. MIFI में F आता है, and therefore MIFI has to be given first, F, and then meso I give second because meso में S आता है, and meso I give second. Okay, so this is wrong. This is meso is not first. तो ये wrong. Similarly, meso is not first, तो ये भी गया. And this is the single tablet of Mifi which I give oral 200 milligram. Okay, 200 milligram, and this each tablet, this is meso is what prostaglandin, that also has been asked, it is PGE1 MCQ. This each tablet is 200 microgram, you can see 4, so that is 800 microgram. I can either give it per vaginal, oral, or even sublingual. Okay, is this clear? And therefore the answer is mifepristone. Here the units are changed. Yes, option number 1 is wrong because this is not 200 milligram and microgram and milligram change कर दिया है clean bold exam में. Okay, so mifepristone 200 milligram, misoprostol 800 microgram after 48 hours. Is this clear to all of you? So पहले देना है मीफी and then dena hai meso. Of course, the gap is 48 hours. Is this understood to all of you? Yes. This is a image based MCQ, completely white. There is no copper. Can you see there's no copper over here? Completely white. So this is the hormone. It contains LNG, and therefore this is your Mirena, or also called as LNG intrauterine device, also called as LNG20. Why LNG20? Because totally it contains 52 milligram LNG MCQ. Every line what I am talking is MCQ, and 20 microgram per day is released in the uterine cavity. This is a copper tea, and the speciality is you will see copper even on the horizontal arms, and therefore my dear student, this is the longest acting. Which is it? Copper tea 380. Copper टी 380 longest acting, मतलब कितना MCQ? 10 years. It can be kept till 10 years. Okay, this each horizontal is 33. This you don't expect you to remember. And this is 314, the surface area of the copper, 33 millimeter square, and 314 you will add 66, and 314 380. Okay, surface area of the copper 33 each sleeve has got 33 millimeter square surface area. Yeah, free of cost in government of India in your medical college and PHC. Okay, and this, my dear student, is a multi-load. Whenever you see this is not T. Copper T क्या होगा? Copper T में it will be T shape. This is not T shape. Here you can see this sun ray. Whenever you get a picture where you have to draw sun, like how you draw sun in the exam, like this in the school, तो ये sun ray appear, आपको ये जो sun दिखता है, sun ray, sun fin, yes, sun ray like thing, very good. So that, my dear student, is multi-load device. Okay, multi-load, yeah, 250, they both are there. Multi-load you get 250 also, and multi-load 375. Both look the same. 250 is for 3 years, and 375 can be used up to 5 years. So all these are important MCQs. And lastly, these are some new picture. These are the implants. Okay, these are the implants what you put in the subcutaneous. 6, 1, 2, 3, 4, 5, 6. So this is now outdated. Norplant system had 6 things, and this is a single rod. This is our implanon. Single rod is implanon. So all these are the important image based question. All of you should get it correct. Okay, And the last question before we go on a break, all of you look on the board. This is very important. All of you look on the board that as per the MTP Act, MTP was allowed till 20 weeks. Now MTP is allowed till 24 weeks. But can you tell me for which indication this 20 to 24 has been done? The 20 to 24 has been done for cases of fetal anomaly if there is a baby problem, any structural anomaly, it could be structural, genetic problem, structural anomaly, or any genetic problem in the baby. Yes, sexual assault victims and rape victims because they might come late. And lastly, क्या दिया है? Special circumstances. Special circumstances मतलब yeah, life of the mother is in danger, then anytime you can do. And special circumstances मतलब कि suppose there's a divorce during pregnancy or husband dies or there is a separation during pregnancy. That's what is mentioned. Okay. कि if there are some other special cases, but mainly आपके लिए ये दो याद रखेंगे कि or if there's a divorce at 21 weeks, 22 weeks, the couple undergoes divorce, all that. Okay. Yes. The important point is, my dear student, that failure of contraception, फेलियर ऑफ कॉन्ट्रा, अगर आपका कॉन्डम फटा है यू कैन बी सिटिंग एट होम फॉर 24 weeks. ओसिपिल फेलियर, कॉन्डम फेलियर, कॉपर टी फेलियर, failure of contraception is still only till 20 weeks. I'm so happy I teach this every year and this has been asked 2 consecutive years, and therefore many students say कि हाँ 22 weeks can be done. Wrong, because we are 22 weeks with occiput failure. So I can only do till 20 weeks after permission of hospital superintendent, after medical board. ये सब नहीं है. But yes, I can do if anomaly also you get in the baby, then yes, and therefore B is the answer. Do you agree with me? 10 thumbs up. Because otherwise occiput failure is only up to 20 weeks only. Thoko tali. This is surely coming in the exam and you will remember me on the day of the exam. Is this understood? And this is again outdated kachra dustbin multi-load. I show you, all of you know. Myrina I showed you, copper T I showed you. This is the outdated device, but question has come. It is a Lippy's loop first generation. No copper inert devices like this shape. This is your this. Okay. Baki sub all 4 pictures I have shown you. Is this understood to all of you? So let us take a 10 minutes break. A 10 minutes break. Okay, where it is 11:40 and we come back and we discuss the further questions. Okay, my dear student, 10 minutes break and we meet in some time. Yes, divorced post 20 weeks, then you can. I told you, Pranav. I told that's a special. Then MTP can be done. Okay, separation, divorce, then you can do. Yes. Okay. So let's meet after. Let's meet after a 10 minutes break. Hello, hello, hello. Can all of you hear me? Can all of you see me? Am I visible to all? Am I audible to all? Can we begin? Perfect. Okay, so yes. So somebody had asked me that up to how many? Yeah, that's also till 24 only, beta. Between 20 to 24. After 24, it is only in exceptional cases where mother's life is at danger or fetal anomie, then with a medical board permission, all that. Okay. So even if all this is up to 24, after 24, all the special permissions are required and the court case and all that. Matlab Supreme Court judgment and mainly medical board, but then all that other things. Okay. Uh, Okay. Yes. So now moving on. So yes. So we have discussed very important topics. If you see, we have discussed topics about infertility, contraception, PCOS, endometriosis. All this we have discussed. Yes. Okay. So now please pay attention. Moving on. So this is yes. Chalo. Next, very important. Again, a short PYQ. It has asked in the past. Uh, PPIUCD, PPIU. This is very important. What is postpartum IUCD? And it is immediate postpartum. How and when? How earliest can we do? And when can we do? Okay. So please and insert it till. So the government has made a new rule that we can go for PPIUCD because patients are not coming back. Ideal is after 6 weeks, but here as soon as immediately after delivery we can do it. If it's a vaginal delivery also, if it's a LSCS also, we can do put the copper tin, close the uterus, or anytime up to 48 hours. Okay, so please keep this in mind. Immediately can be done till your 48 hours window. After that we avoid it, and then we go at 6 weeks. Okay, if this window is missed, then after 6 weeks, because then the uterus comes back to normal size. After 6 weeks also we can do it. Okay, is this clear to all of you? Yes. Moving on to the next very important MCQ. Chalo. 47-year-old paraplegic company of menorrhagia for 3 men. Next line of management is A B C D A B C D. Majority D D D D D D D. Wrong. Clean bold. Googly. Picture अभी बाकी है, बताते हैं. चलो. 14-year-old puberty में young patient, young girl. All are the important investigations. Heavy periods मतलब the heavy menstrual bleeding or menorrhagia. All are the investigations indicated in a 14-year-old girl except. Okay. Yes. Very good. Very good. Coming to the answer, all we are doing. Yes, next, very important. ध्यान से सुनेंगे longest question, but answer already diagnosis discussed in my previous session if you paid attention. What is it? So there is excessive bleeding and dysmenorrhea. So heavy menstrual bleeding plus dysmenorrhea. There is uterus diffusely enlarged, no mass, and ultrasonography, multiple cystic spaces in the myometrium. Can you tell me? No, Ruchika, endometriosis outside. ये क्या है? Cystic spaces within the myometrium. I drawn the picture and show you. ये क्या है? ये क्या है? ये मल्टीपल, इसमें इनफर्टिलिटी नहीं है, मल्टीपैरस है ऑलरेडी. Yes, adenomyosis, and the most definite, it is not endometriosis, and different. Okay, yes, symptoms can overlap. Okay, yes, but I will show you the picture also, and I'll show you this also. Okay, yes, and the last question before we go to all the OHSS. OHSS, किधर OHSS? जिमित क्या कर रहा है बेटा? हाँ, okay, yes, हाँ, okay, yes, and this is a new, absolutely new 7-star MCQ, which is the recent advances. Thoko tali when you will come to know which of the following menstrual cycle length is considered abnormal. Just a second, all of you. Yes. Okay. Yes. So all of you now let us go on and start our discussion. We had finished over here. Yes. Okay. Now all of you pay attention. What is this patient? The important point to be kept in mind is, yes. Okay. So now please pay attention. This is majority students clean bold. They will say, sir, 47, para 3 living 3, hysterectomy. Na rahega bas, na bajegi basuri, remove the uterus. Wrong. Why never direct hysterectomy? Because please keep in mind, 47 matlab perimenopause. And whenever the patient is perimenopausal, no occipitals, no progesterone. What is the rule? Please keep in mind that any patient who is having heavy menstrual bleeding in the perimenopausal age group, please write down the words. What is the dictum all of you forgot? HPE. HPE is mandatory. Histopathological examination of the endometrium mandatory. Why? Because I need to rule out endometrial hyperplasia, endometrial cancer first. Is this understood to all of you? I need to rule out in a 45. This all is 45 plus 46 plus. Okay, HPE का मतलब है कि एक टुकड़ा लाइनिंग का, आप ध्यान से सुनेंगे शायरी क्या है, एक टुकड़ा लाइनिंग का माइक्रोस्कोप के नीचे आना चाहिए. And therefore I will either do a DNC first, and all this endometrial hyperplasia cancer can only be made under the microscope. The diagnosis can only be made under the microscope. So either I will do a DNC, or I will do a endometrial biopsy, or I can even do a hysteroscopy. Yes, hysteroscopy plus biopsy. Important word is biopsy and dilatation and curettage. Yes, it's not about eventually. Yes, that's okay. Eventually she can reach menopause. And so the next line is first do a DNC, and then only after DNC. Why remove the? Yes, you can save the uterus. She can reach menopause soon. We can insert LNG IUD. If it's so, I'm not saying don't do hysterectomy. First you will do A, then hysterectomy if required. If required, you will do the hysterectomy. Suppose it is cancer, but of course hysterectomy. It is hyperplasia, also better to do hysterectomy. And if hyperplasia and cancer is not there, so DNC will be done to rule out endometrial hyperplasia and endometrial cancer. Clap if you have learned something new on a Friday morning. Directly, never progesterone. Progesterone be बाद में, OCP is never in 45 plus. 40 plus में never OCP. Okay, so after your A, first you will do A, and after A we can think of option B also, or we can go for LNG IUD as somebody said. Yes, Marina. Yes, very good, Ayash. Can Mirena be inserted? Definitely, Mirena can be inserted. Mirena will cause the menstrual to come under control. Heavy bleeding will stop. Mirena is for 5 years. From 47, she will reach up to menorrhagia. Okay, she will reach up to, she will reach up to menopause, and then 47, 48, 52, 53. And yes, then even option D is also available. So first is always A, and after option A, I can give progesterone orally, or I can give LNG IUD, or then even hysterectomy as a last resort. Also, you try to save the uterus. Okay, you try to save the uterus. Okay, wherever possible, try to save the uterus. Is this understood to all of you? Yes. Okay, my dear students, moving on. Now here similarly we have got what why, sir? I don't know what Venkat side. I didn't understand beta what why. I didn't understand your question. Venkat Sai, can you please clarify what's your doubt? Because hysterectomy is a major surgery, and you should always try to save the uterus. Any surgery, yes, you should save the uterus, because you cannot do any surgery if it's not, it has got a surgery, it's got lots of complication. Therefore, you should try to save the uterus. का मतलब है कि wherever possible, I will avoid a surgery if it is possible. Otherwise, lots of surgery, like you have appendix. Appendix has got any role in your body? No. Then tomorrow go and get the appendix removed. Okay. Many other things are not there. So you can so don't do unnecessary surgery. That's the meaning of save the uterus. You try to save the uterus, because hysterectomy can land its own set of complication. When you do hysterectomy, early menopause, all that other complication है. कहने का मतलब यह है कि first you will do DNC, and if the Mirena can work, why to remove the uterus? And a LNG IUD can work. This is so good. So many students message me. No, definitive beta will depend on the DNC report. DNC report will decide what is the definitive treatment. Okay, hysterectomy can never be done directly. Is this understood to all of you? Varshit, Akula also. Never, whenever I have got a patient of perimenopausal age group, you can never direct hysterectomy. Please keep this rule in mind. Okay, it is clear, you will first do the DNC and then decide. Yes, if it is cancer, 100% hysterectomy. If it is hyperplasia with RTPR, then 100% hysterectomy. Okay, but now when I come in a 14-year-old girl, thyroid can cause menorrhagia, hypothyroidism, hyperthyroidism, bleeding time, clotting time, because they could have some bleeding disorders, and PT, APTT, von Willebrand, ITP, enough all our investigation, except here I don't do a endometrial sampling. Is this understood? Is a young 14-year-old girl, no need to put in speculum and put in dilator and do a DNC and all that. Is this clear? All of the following are to be done, except is the question, except D is the answer. Endometrial sampling is required in a perimenopausal age group. Is this understood to all of you? In a perimenopausal, this is a puberty menorrhagia. This is a MCQ of puberty menorrhagia, young girl. Yes, and for endometrial sampling, not at all required, no role, not required, there is no role. Is this clear to all of you? In a young 14-15-year-old girl, we never do this. Okay, moving on. Yes, this is what I had already told you. Okay, sir, this is your cystic spaces. Okay, this is adenomyosis, where I had shown in the beginning of the class only cystic spaces within the myometrium, that is adenomyosis. Again, this is a difficult virgin MCQ, just to show you the same thing. Okay, this they will tell you is a sonography of a uterus, and you can see the endometrium is okay, and you can see the cystic spaces. Can you see the cystic spaces? They are within the myometrium. So this is adenomyosis, difficult virgin MCQ. Okay, but just to show you the topic. Okay, and unfortunately in adenomyosis, yes, of course, we try medical management first. We try medical management first, but medical management does not work so nicely, and therefore here hysterectomy. Which of the following is the most definitive management? Okay, definitive management is what? Okay, in this case it is hysterectomy. Okay, is this clear to all of you? Of course, here also we will do that first. We will rule out hyperplasia cancer also first, because she's 43. Okay, so here also we will better to do a endometrial biopsy also. This rule is applicable here also. Okay, please keep in mind, any patient who is perimenopausal with heavy menstrual bleeding, of course sonography will be done, but HPE is mandatory. But here the question is that in a proven, here my diagnosis confirmed, and the question is that adenomyosis. Okay, so here the question is that adenomyosis, what is the most definitive management? Sir, here hysterectomy is the only option. Yes, you can try progesterone first. Embolotherapy does not work and OC pills are not allowed. Or progesterone, IUCD or Mirena can be tried. Mirena can be tried if the patient wants to avoid surgery, but the most definitive treatment is hysterectomy. Is this understood to all of you? Yes. Okay, and keep this picture in mind. And this is the recent thing. Please keep in mind, 7-star new. The old guidelines, the old criteria was 28 plus or minus 7. That means from 21 to 35. Yes, 21 day cycle. If it is less than 21, we call it as polymenorrhea. If it's more than 30, we call it oligo. Now this has become old criteria, old, and therefore the latest FIGO. I do not know why they did this. Okay, no beta, never. Danazol, danazol to never beta. Danazol kachra dustbin. Yes, very good, Dr. Furz. अच्छा आपने फर्ज निभाया है. Please understand this, the latest FIGO guideline says that 24 to 38 days is, they have added 3. I don't know why this is done. I have really no answer. कि यहाँ पे 21 पे 3 add कर दिया, 35 में 3 add कर दिया, and therefore all this is considered okay now. And more than 38 days if the lady is, this is the latest answer or the new answer. Is this understood to all of you? Clap. And that's why you get the latest information. OG in the chat box. Only with my lecture you will get the latest information. Okay, and therefore 38 is the answer over here. Okay, is this understood? So 35 was the answer, but now the new criteria, the new FIGO says that 24 to 38 day is considered normal, and therefore more than 38 day is the answer. Yes, next question. Patient complains of postmenopausal bleeding. 1 by 1 centimeter nodule seen on the ultrasound. The most appropriate investigation to be done is okay. Moving on. Okay. 30-year-old nulliparous pap smear abnormal biopsy CIN3. The next line of management is. Please don't use the chat box. If anybody is using the chat box in the app, I will not be able to answer because I cannot see it right now. So I'm requesting all to use only Telegram for communication during lecture. Okay. 55-year-old ABCD. Is the same question के आंसर चेंज सेम क्वेश्चन से दोनों क्वेश्चन सेम है क्या फर्क है ये भी सेम क्या है डिफरेंस इज देयर डिफरेंस वन वर्ड नेक्स्ट what is this what is this image based virgin again a virgin MCQ yes very good all of you super tandem radiotherapy. What is this tandem radiotherapy? Again, a very important recently asked question, and surely it will be repeated. And two questions coming back to back. Okay, in this, tell me the answer. Cervical cancer stage 3B, the treatment or the management is. I'm going to teach you stage wise management so you all will become perfect. Cervical cancer stage 3B treatment is. So again, please understand, question is the same but options are different and how the answer will differ. Okay, that is why मैं हूं ना. Okay, so total confusion A, B, C, D. Yes. Now, all of you pay attention. Point number one. Yes, this will. Okay. Yes. Now, cervical cancer is the most common cancer for ladies in India today. Point number one. Whenever I do a patient complaints of postcoital bleeding or postmenopausal bleeding, and you do a per speculum examination, and if on a per speculum we are seeing either they tell you a nodule, okay, they are saying any hard mass, physical mass you can see, or any fungating growth. Is this understood to all of you? Many student mark pap smear as the answer. Wrong. Clean bold. Pap smear ka time chala gaya. Pap smear should have been done 10 years back. If every lady does the pap smear is a screening to prevent cancer. 21 years to 65 years. Pap smear, they will. You should know everything. What is the age group for pap smear? We should know. Pap smear is done from 21 years to 65 years. That's the age group for pap. Keep in mind. Okay, but that is done when the as a screening test. When the patient has come to you with either a nodule or a fungating growth, very good. I will now take a bite of that growth, and that is the punch biopsy. Is this understood? Pap smear ka time chala gaya. So please keep in mind, if they tell you patient has just come to us with screening or just has come to us in the routine OPD checkup, then pap smear okay. Here I can see the growth. We can see this 1 centimeter nodule, and therefore never directly jump to the management. Hysterectomy, when to do, all that we'll discuss. Here the answer is punch biopsy. Okay, punch biopsy is what you will do and then decide. Now, when do I do colposcopy also? I will teach you, don't worry. Yes, is it clear? 10 thumbs up. Now, please pay attention. The question over here is, okay, what do you do management of CIN3? CIN3 is cervical intraepithelial neoplasia. And please, for anybody, CIN3 and stage 3 CA cervix, same, right? Is it same or different? Same, correct? CIN3 and stage 3 cervical cancer, same, right? Same. Same ke different? Completely different. Very good. Completely different. Those who say same, they do not know the basics. They are not the same. Please understand this. CIN matlab the basement membrane is intact. Patient may develop first CIN1, then CIN2, then CIN3. Also, carcinoma in situ has almost the same, and then the basement membrane gets ruptured, and then the actual cancer starts, and then stage 1, stage 2, stage 3, stage 4. So please do not confuse. दोनों poles apart है. ये CIN है, cervical intraepithelial neoplasia. So this CIN3 and carcinoma in situ and यहाँ पे stage 3 cervical cancer are completely different. Very good. Now please pay attention. What you need to keep in mind is that whenever, sir, I have got a patient of CIN3, very good, it's a pre-malignancy, and the treatment will depend whether the patient is young. Whether the patient is young, they will say in the question paper, young or nulliparous. That means she wants to preserve the uterus. Or they will say that the patient is old, 40, 45 plus, postmenopausal, family, complete, like that. Okay, now please understand this, that here when we have got CIN3 only in a young patient, I do the procedure called as loop, loop electroexcision procedure, also called as long loop, large loop excision of the transformation zone. Okay, how? Yeah, of course, 100% better, 100% Ishan, but not in cancer cases. You have to remove those. So we are coming to that. Okay, so in cancer you can't give the. Otherwise, always we should consider the age. Okay, if it's a 35, 40, you'll try your best to save the uterus. Okay, yes. So we are coming to that. Unless it's a cancer where it's life saving. Okay, Ishan. If the pathology where hysterectomy is life saving, like if it's a cancer, then I will remove the uterus. Let the girl be 40, 38, 37. Otherwise, we are saving the life. Okay, yes. So for benign condition, definitely age has to be considered. Okay, so LEAP का full form क्या है? Loop electro excision procedure. Okay, loop electro excision procedure, जहाँ पे details are not important, एक loop होता है and you burn the transformation zone. So that is done in a young patient. So when I have got a 30-year-old nulliparous lady, and those who will mark your hysterectomy, you have to go to jail. ठोको थाली jail. Jail मतलब you'll have to go to jail. Government I will put you in jail for removing a uterus in a 30-year-old nulliparous patient because not required. And she is CIN3. So you will not do the jail. मतलब जेल लिखना मतलब हम बोलेंगे जेल मतलब सर बोला जेल में डालेंगे. ओके, बट हाँ जेल में जाएंगे ऐसा याद रखो. Okay, you'll have to go to jail. Okay, but never. Okay, basically never. And here the answer is LEAP. You don't have to repeat. Repeat can be done in CIN1, CIN2. Here already it is CIN3. So this flow chart we are coming to LEAP or LEADS, large loop excision of the transformation zone. And if the patient is old and the family is complete, then we prefer to do a simple hysterectomy. Is this understood to all of you? Now simple का मतलब क्या है? Please understand this. It is not simple to perform. It could be abdominal which hysterectomy? Abdominal, vaginal, laparoscopy, that is okay. Simple का मतलब क्या है? All of you, yeah, simple का मतलब क्या है कि I will only remove the uterus and the cervix. That's it. Simple. I will only remove the uterus and the cervix. No need of removing the parametrium, lymph nodes, vagina, ट्यूब, ओवरी, वो सब नहीं निकालना है. सिंपल हिस्टेरेक्टमी. सिंपल हिस्टेरेक्टमी मतलब only remove the uterus and the cervix. That's it. Okay, like any other benign pathology. Simple hysterectomy मतलब के what hysterectomy I do for fibroid, prolapse, menorrhagia. Simple का मतलब है like any other benign pathology. So because CIN3 is not cancer, sir, CIN3 may become cancer. And that is why, my dear student, when I have got a 55-year-old para 3 living 3 CIN3, LEAP I told you we do in the young patient, and here Verdheim hysterectomy is not the answer. Verdheim hysterectomy is for actual cancer. Which stage is all that I will tell you. Okay. Okay, is this understood to all of you? Here the answer is simple hysterectomy. Can I get 5 thumbs up? I repeat, this is a 5-star slide. Keep in mind, CIN3 in a young patient will go with LEAP or LEADS, and old patient, family complete, we will do a simple hysterectomy and not, please, because students को क्या है, कहीं पे भी कुछ भी पढ़ा, CIN, cancer, direct Verdheim hysterectomy. Okay, not Verdheims, लिखो, not Verdheims. Okay, is this understood to all of you? Not Verdheim hysterectomy. It is like any other benign condition, like any other benign pathology. We will give a, what do you call it? We will do a simple hysterectomy. So I come back to both the questions. I repeat, CIN3 का मैनेजमेंट क्या होगा? Either leak or leads or a simple SH मतलब simple hysterectomy. And both the questions, so question number 1, 30-year-old है, hysterectomy नहीं करना है, answer is leap. Okay, and same MCQ, only the age change, only the age has changed. Now she's 55. Again CIN3. So here I will do not Vertime for actual cancer. Here I will do a simple hysterectomy. Simple matlab just like any other benign condition. You any other benign condition, we will what do you call? We will just remove the uterus and the cervix like for any other benign pathology. Why? Because it can become cancer, but it is not yet cancer. It is not yet cancer. It is not cancer. It is not cancer yet. Okay, and therefore simple is okay. Okay, because it is not yet cancer. Now, very important. This whole thing आपको क्या है कि ये क्या है? Please understand this. This whole picture is looking green. This is cervix. This is the anterior lip of the cervix. This is the posterior lip of the cervix. This is the cervix. And whole cervix is looking what color? Green color. Green. तो ये किसका cervix है? ये Hulk. Hulk. Lady Hulk. She Hulk. Lady Hulk का cervix है. No. Okay, so this is not a hysteroscopy. I have shown you hysteroscopy, you go inside the cavity. Then similarly, this is not a pap smear being taken. This is a colposcopy, and in colposcopy, we are using something called as green filter. Now, my dear student, this green filter MCQ has come in your entrance exam. But this image is a virgin image, virgin IBQ. Next year. Okay, now please understand this. That what is this green filter? Sir, in colposcopy we use for magnification, we apply acetic acid. In colposcopy, we first apply yellow light. And green filter is nothing but green light. There's a green color screen. So that why do you see green filter? Because physics principle, with green color light, the blood vessels, they can ask you this question. Okay, what is the purpose of using green filter? Blood vessels are seen better. Yes, very good. So whatever, if there's any abnormal vasculature, any abnormal blood vessels are there, then they would be seen very nicely with your green filter. And blood vessels is your neovascularization, sign of danger, sign of cancer. Okay, so remember this green color picture, this green filter MCQ has been asked. Green filter is to see the blood vessels better. Okay, and otherwise, you know, we apply acetic acid and we take the biopsy from the acetoid area. Okay, yeah, not colonoscopy, colposcopy. Okay, yes. So colposcopy is the answer. Green filter, colposcopy. Yes. Now, tandem radiotherapy. What is this tandem? Tandem, and the new word can come, ovoid. Tandem plus ovoid. Now for this, please pay attention, and then these two questions also. Okay. Now what is this? Please pay attention. Whenever 7-star slide. Whenever I have a patient who is stage 1A1, okay, very early cancer. 1A1 is a micro-invasive cancer. Till here we take the patient ka age into consideration. 1A1, if I have a young patient, then I can do something called as therapeutic conization. Please by heart this. It is a stage-wise treatment. I can only make it easy for you, but you will have to mug up. But if it is a old patient, then again only a simple hysterectomy is okay. So see, they can ask you this question. For which cancer also simple hysterectomy? Sir, 1A1 cervical cancer. Now जब हम आगे बढ़ते हैं 1A2, 1B and 2A. Only these three stages of cervical cancer are operable. Please repeat three times. 1A2, 1B, 2A. 1A2, 1B, 2A. Here we do the radical hysterectomy, or nowadays modified radical hysterectomy, or your Wertheim's hysterectomy. Wertheim is the name of a doctor. Wertheim is it's called a modified radical or a radical hysterectomy. Okay, is this understood? And beyond this, after this 2A के बाद क्या आएगा? 2B, 2B, 3, 3A, 3B and 4, of course 4A, 4B, all become inoperable, and I will treat them with only radiotherapy. More points coming up in a minute. Now this radiotherapy, your teacher will also teach you. This radiotherapy is of two types. एक होता है दूर से जब हम रेडिएशन देते हैं तो टेलीथेरेपी, एंड very close to the organ we give brachytherapy. And it is here in this brachytherapy के tandem is a rod. Tandem is a rod. You will put it inside the uterus. Okay, so tandem is a rod in which the radioactive material is charged. On this tandem is a rod. This इसको rod इसको tandem बोलते हैं. Okay, in this you have that radioisotopes. No, beta, OBS is on Monday. Okay, and then you have got ovoids. So it is looking like this. So please Google it and you will get an image. Tandem and ovoid. So this vertical rod is called tandem and this is called ovoid. And this is basically a form of brachytherapy for cervical cancer. Tandem and ovoid basically provide radiotherapy for which stages? Anybody? For stages 2B, 3, 4B inoperable. Okay, so radiotherapy is provided by this tandem. Okay, radioactive material is charged. You put all the radioisotopes, you charge it and you put it inside the uterus. So from here it will give radiation, it will give radiation to the cervix and other organs. Is this understood? Clap if you have learned something new. Okay, so that is your tandem radiotherapy. Okay, now, yes, perfectly correct. Okay, tandem radiotherapy. Very good. Okay, now all of you please pay attention. This is radiotherapy, and therefore please understand this. Only chemotherapy is wrong. And stage 3B, chalo. Stage 3B, do I do Wertheim's? No. Do I do debulking? Do I do chemo? No. And radiotherapy is the answer. Clear? Clear? Yes. Radiotherapy is the answer. Only chemotherapy, no rule. But. Along with radiotherapy, cisplatin is given before radiotherapy as a radiosensitizer to boost up the effect of radiotherapy, and therefore the newer word is CTRT. CTRT या concurrent chemoradiation. Is this understood to all of you? Concurrent chemoradiation is the word which is better. Yes, same size. Cypria, very good. It's called concurrent chemoradiotherapy, CTRT, or concurrent radiotherapy, whereby cisplatin is given first, followed by radiotherapy. But keep in mind, only CT is wrong. Only CT is wrong. And therefore, in this MCQ, radiotherapy is the answer. But here, see the options change. Why am I showing you this MCQ back to back? Thokotali. It's the same thing. Stage 3B. Verdheim's out. Only chemotherapy out. And now when I have to choose between radiotherapy and chemoradiation, sir, chemoradiation is the answer because D is much better than B. Is this understood to all of you? So sir, yes, option. That is why my students get this concept clear कि आप कितना भी बुक्स पढ़ो, सर एक बार बुक पढ़ा, आंसर दिया आरटी, एक बार सीटी आरटी, टोटल कंफ्यूजन. Till you listen to me, you can never get MCQ correct. So I repeat, sir, RT is the answer, but CTRT better. CTRT is better. Okay, CTRT is better than RT. Better than RT. Is it clear? So therefore, if separate जैसे यहाँ पे है radiotherapy, chemotherapy separate, then I will choose radiotherapy as the answer. Clear? Yes. So if only RT, correct, but if CTRT is in the option, then please mark CTRT as the answer. CTRT is a better word to use and better therapy. And therefore in this question, radiotherapy is not completely wrong. It is right, but not the best answer. The best answer is CTRT. Understood to all of you? Yes. So finally सब बॉइल डाउन होता है ये स्लाइड पे. इसको आप छाप के ले लो. Take 2 minutes to write this down, or whatever you want to do, click a photo, whatever, just keep this in mind. It's a stage wise treatment of cervical cancer. For stage 1A1, we can go with a therapeutic coneization or cone biopsy in a young patient. An old patient, simple hysterectomy is good enough. 1A2, 1B, 2A patients, we are going with a surgical uterus removal, modified radical hysterectomy or a vaginal hysterectomy, and beyond this stages they become inoperable, and therefore आगे के सब stages हैं 2B, 3A, 4 or all CTRT. Is it clear? Very प्रणव, टेली वर्स ब्रैकेट बेटर, टेली और ब्रैकी, वो आपको टेली और ब्रैकी इज योर रेडियोलॉजी टीचर विल टीच यू. टेली एंड ब्रैकी का मतलब है, टेली इज अ एक्सटर्नल बीम रेडिएशन व्हेन फ्रॉम फार. टेली का मतलब क्या है? व्हेन यू फ्रॉम फार, व्हेन फ्रॉम फार यू गिव, when from external beam radiation, when from far you hit the patient with radiotherapy, external beam radiation. And brachytherapy means going close to the organ. You are giving radiation close to the organ. That is the meaning. Understood, Pranav? Okay. So here टेली में दूर से बीम आता है, ब्रैकी में यहाँ पे देखो नजदीक से है. सो दिस ब्रैकीथेरेपी, दिस इज ब्रैकीथेरेपी. ब्रैकीथेरेपी, ब्रैकी रेडियोथेरेपी. So in this tandem and ovoid, the radiation is given to the cervical cancer. Okay. हाँ, very good. हाँ, so this is all internal. Yes, yes. Yes, so that detail, yes. Perfect. Okay, is this understood to all of you? Short, yes. And this is what? Again, an image-based question. This is your standard air spatula. Okay, this wooden thing is the air spatula. Taken for what? For pap smear. Okay, for pap smear, this you rotate it onto the cervix, this goes in the posterior fornix, and this is for the traditional pap test. Okay, the conventional pap test. And जो राइट साइड में दिख रहा है is the advantage new liquid based cytology. This is a cyto brush, and you rotate this brush on the cervix, and this tip is broken and directly put into the liquid, and this whole liquid is sent for testing. That is the liquid based cytology. The advantage is we get a better sensitivity, specificity. We can see the cells clear, pap smear is crowded, liquid based cytology is a clean thing. And can anybody tell me the most important advantage of LBC? Today we prefer LBC. What is the advantage of LBC over the standard pap? PG level stuff, but yes, you should know. Yes, so not cheap. No, no, but it is more expensive. It is more expensive. It is not cheaper. Liquid based cytology ka the advantage is that HPV typing. I can do HPV typing. That means today I can tell the patient whether she is infected with HPV or not, human papilloma virus, and I can also type the HPV. I can tell the patient that okay, you are infected with HPV 16, 18, which number? Okay, so HPV typing is possible only by doing this LBC technology. It's a newer technology, it's more expensive. So normal PAP अगर 300 का है तो yeah, accuracy is also slightly better, more cost, around double the cost, but HPV typing can be done by doing this liquid based cytology. That's a new thing which I wanted to tell you. Okay, yes. Now again, yes, sample can be taken for HPV. If they tell you that patient wants to do HPV, then you have to do LBC only. Yes, 6, 11, 16, 18. Yes, very simple. Chalo, drug of choice for trichomoniasis is positive whiff test. Positive whiff test. Fitzhugh-Curtis syndrome. Fitzhugh-Curtis syndrome. Image based question. Image based question. ये क्या है? What? I'm giving you a clue. What fruit? Yes, very good, very good. All are part of Amsel's criteria except very important. Yes, what is the difference? And identify this picture. Identify this virgin image based question. ये क्या है? Yes, very good, very excellent. Your comment. Very good. Okay. Now, all of you, please pay attention. Point number one. Point number one. Trichomonasis. What is the type? Very short. 2 marks, 1 to 2 marks surely on this topic. Tell me the type of discharge in trichomonasis. How is the discharge? Anybody quickly? Trichomonasis का discharge कैसा होता है? So there is greenish yellow frothy discharge. I need to treat both the partners, and yes, metronidazole is the drug of choice. Metronidazole is the drug of choice, and you will see a flagellate motile organism if you do a smear. Okay, flagellate motile organism, greenish yellow frothy discharge. Excellent, all of you. Can you tell me the what is the type of discharge in candidiasis? In candidiasis, what is the type of discharge? So candidiasis में curdy white, cheesy white, cottage cheese white, पनीरी वाइट, शाही बटर मसाला, पनीर बटर मसाला, शाही कुरमा, शाही पनीर. कहने का मतलब है एनीथिंग टू डू विद डेयरी प्रोडक्ट. लस्सी वाइट, वेनिला वाइट, वॉट एवर वाइट, वाइट इज वाइट. ओके, सो एनी कर्ड, बटर, मिल्क, लस्सी, कॉटेज चीज. यस, वेरी गुड. आइदर कर्डी वाइट और दे विल टेल यू कॉटेज चीज. कॉटेज चीज का मतलब है कि पनीर. Okay, curdy white, cheesy white, or cottage cheese. Okay, yes, perfect. Okay, that is your candidiasis. Okay, now positive whiff test. What is this whiff test? Sir, you will take the secretions. You will take the secretions, and to that, if I add a 10% KOH, I will get a fishy odor. Okay, fishy odor because of release of amines, and positive whiff test is seen in Gardnerella only. Yes, Gardnerella. And one more thing very important, Gardnerella के लिए भी metronidazole drug of choice. Keep in mind. And what is, I'll come back to this in a minute. Amsel's criteria. Amsel's criteria is for diagnosis of bacterial vaginosis or Gardnerella. Totally, there are 4 criteria: grayish white discharge, positive whiff test, presence of clue cells. What is this clue cells? What is this clue cells? They are vaginal epithelial cells loaded with the organism. Okay, so the organism, they are adherent to the cell. Okay, and very good, the answer is vaginal pH less. Okay, only the sign is changed. For Gardnerella, pH is more than 4.7. Beta, for mano, for no, trichome is also 5.5 to 6.5. Okay, for trichomonas is also the trichomonas also pH is 5.5 to 6.5. Candidiasis के लिए less than 4.5 acidic pH. Yeah, very okay. So all the organism is stuck onto it. Yes. Okay. Yes. Now this is rightly said. Strawberry cervix or strawberry vagina, and This is a part of your, not all of the above, trichomoniasis. Punctate hemorrhages, you will see this hemorrhages, it could be in the cervix or vagina. Strawberry cervix भी बोलते हैं, strawberry vagina भी बोलते हैं. Okay. Yes. Okay. So that is your trichomoniasis. Perfectly correct. Now please, many student made a mistake. Omental adhesion नहीं है. Similarly, intrauterine adhesion, already told to you 3 times today. Intrauterine is Asherman. Asherman is intrauterine. Fitz-Hugh-Curtis syndrome is a perihepatic adhesion. Adhesions in the liver and the diaphragm. Is this understood to all of you? And that's the same picture. Same picture. Okay, so perihepatic. C is the answer. Okay. The same picture is over here. Yes, we will see this is the liver, this is the diaphragm, and you can see all this violin. इसको क्या बोलते हैं दूसरा? Violin string adhesions. Okay, violin string adhesions. So very clearly you can see the liver, you can see the diaphragm, and we can see the adhesion. This is a virgin image of Fitz-Hugh-Curtis syndrome. Fitz-Hugh-Curtis syndrome. RMKH, I told you, absent uterus, normal ovaries. And lastly, anybody, what is Kalman syndrome? What is Kalman syndrome? Nothing to do with it. Kalman syndrome क्या है? Yes. Anybody, what is Kalman syndrome? Yeah. Very good. So Kalman syndrome is basically GnRH, gonadotropin releasing hormone, hypothalamus है. GnRH deficiency. So if master is only not getting master is only sleeping. So GnRH deficiency, very good. So all hormones will be low, and along with that, there is a sense of smell is defective, anosmia. Okay, so basically there is anosmia, and there is GnRH deficiency, and there is, yes, it is very good, Swashbuckler. It is called as hypogonadotropic hypogonadism. Okay, so please understand this. It is an example of hypo. Okay, so hypogonadism ही होता है. Now please, again, this is clarification. Many students have confusion. Hypogonadism. Now this could be hypogonadotropic. Can you give me an example? Or it could be hypergonadotropic. So hypergonadotropic hypogonadism का मतलब क्या है कि hypogonadism मतलब ovary is not functioning, and hypergonadotropic मतलब FSH is very very high. So that is where I told you example menopause. Okay, menopause. I'm just giving example. Or your premature ovarian failure. Ovary have failed before. Okay, premature ovarian failure. I'm just giving you example. All that are example of hypergonadotropic hypogonadism. ठोको ताली. And hypogonadotropic hypogonadism मतलब के FSH itself is gone down. So your example क्या होगा? Yes, your Sheehan syndrome. Sheehan's में postpartum pituitary neck. Sheehan's या Kalman. Is it clear? Where FSH itself is very very low. Okay, thoko tali. So this is again absolutely concept. So it's called hypo or hyper. Okay, hyper gonadotropic hypogonadism or hypogonadotropic hypogonadism. Okay, so just for concept. So examples of premature ovarian failure, very good. And Kalman and Sheehan's are our examples of hypogonadism, where FSH itself is going to be low. Okay, perfect, perfect. Okay, so all this is extremely important, and surely questions are going to come on this from this. Very quickly, before we proceed further, all of you may have done it. If not, please take 30 seconds and quickly start following me on Insta. Lots of interesting stuff is coming up. We have put the Musa, we have put the adenomyosis sonographic. Latest I put all the doses of the oxytocin also, and on YouTube please go and see. I'll also post the video of what last 30-35 day end game hai, kaise karna hai, kya karna hai. Those who haven't yet followed, please start doing it right away, because almost 100 new students I think have been added to the group today. Okay, yes. Yes. Okay. Now, very important. Please pay attention. Please pay attention. So it is all this. Now, the next very important. So but FSH could be high in anything. So basically, Dr. Ishak, even premature is a pathological. So any condition where the ovarian function is diminished, so that you could get in diminished ovarian reserve. Okay, menopause is normal. Menopause is natural. But any case where there is diminished ovarian reserve, मतलब the egg capacity is becoming low. That is a case where FSH will be high. That is same as premature ovarian failure. Okay, that's the okay. So where FSH could be high in this. Okay. Yes. Now please pay attention. Very important thing what you should keep in mind is your this we know. Now 2 to 3 questions on prolapse uterus. प्रोलैप्स यूट्रस. नाउ एक तो प्रोलैप्स का आपको ये होना चाहिए कि व्हाट इज द डिग्रीज ऑफ प्रोलैप्स. फर्स्ट डिग्री, सेकंड डिग्री, थर्ड डिग्री, फोर्थ डिग्री, एनीबडी? सो प्लीज अंडरस्टैंड दिस. vaginal opening is considered as the landmark. Vaginal opening. Suppose this is the vaginal opening. Okay, and the cervix I will draw in black color. Okay, so if this is the vagina, okay, cervix comes down from its normal anatomical position, and cervix is in the vagina only. That is first degree prolapse. Okay, when the cervix is at the level of introitus, that is second degree prolapse. Cervix, so I'm not drawing the uterus. Uterus ऐसा हर जगह पे drawing understood है. Okay, cervix is here, so uterus will be here. Okay, now when the cervix is outside the introitus, that is third degree. Is this understood to all of you? So this red is the vaginal opening or introitus. Okay, and the whole of the uterus, including the fundus, that means sir, this you can see over here now here. Okay, yes, you can see कि sir cervix तो बाहर है ही, even the fundus. Okay, even the fundus is outside the introitus. This is called as, yes, fourth degree or prosidentia. Okay, please keep this in mind. Okay, cervix is outside the introitus. So this is very important. ये question आया है, and something new. Anybody, two things you have to keep in mind. So this fundus. Okay, two things you have to keep in mind. What is the POPQ classic virgin, no longer virgin? It came for the first time in the last year FMG exam, surely likely to be repeated. POPQ, POPQ classification. Details is not important. Also called as the word grid. क्या है grid? Grid staging. Both these questions have been asked. In POPQ classification is what? Pelvic organ prolapse quantification, where stages of prolapse. POPQ classification, important MCQ, hymen. Hymen is the reference point. MCQ has been asked. Okay, what is the reference point in your POPQ? Just keep in mind, for pelvic organ prolapse quantification, the hymen is the reference point. Okay, and another important MCQ. All these are MCQs. Yes. Okay, and grid matlab kya hai? There are 9 grids, like how you play X and 0. There are grids and there are fixed points on the anterior wall, posterior wall, how much cervixes come out, like this grid is done, and it's a 9 grid is made. So grid staging is also for prolapse only. Okay, both are same. This pelvic organ prolapse quantification or grid staging is the same thing. I'll tell you grid classification, grid staging, all that is for prolapse. Question आपको खाली इतना ही आएगा. Okay, 9 point. Yes, question खाली आपको इतना ही आएगा. Question क्या आएगा? All of you look on the board. Question ये आएगा आपको कि grid staging is for bus or grid classification is for fibroid. चलो, tell me the answer. Fibroid, CA cervix, prolapse, और heavy menstrual bleeding. चलो, what's the answer? इतना ही question आएगा. Okay, grid staging or grid classification is used for what? Prolapse. You'll thank me on the day of the exam. Answer is prolapse. Okay. Now, the last thing in this is, of course, when the lady is old and we have a patient of prolapse, again remember 2 things. ना रहेगा बास, ना बजेगी बांसुरी. So when the patient is old, family complete, what do you do for prolapse? Anybody? 47-year-old, 57-year-old, 65-year-old, then what surgery I do for prolapse? Okay, sir, we do a hysterectomy. Very good. The word vaginal hysterectomy has to come. If you say abdominal hysterectomy, wrong, stupidity. Please, uterus नीचे से आ रहा है, ऊपर को धक्का मार के abdominal नहीं करना है. Vaginal hysterectomy we do, and generally with it we do also colporrhaphy. What is colporrhaphy? Colporrhaphy is your vaginal hysterectomy plus colporrhaphy. Colporrhaphy is for your cystocele and rectocele. Anterior colporrhaphy, posterior colporrhaphy. Okay, very good. Okay, so vaginal hysterectomy with colpo means vagina, rhaphy means repair. This is the best operation for a old lady with, I repeat, vaginal hysterectomy. Hysterectomy, yes, but say the word vaginal. Okay, and also tell the steps of it. Okay, and now when the patient is young, remember one thing: if she is nulliparous, okay, nulliparous, that means she wants babies in the future. Outdated surgery, kachra, dustbin, Fothergill. Now, can anybody tell me why we don't do a Fothergill surgery? Because this question has been asked. Sir, in Fothergill surgery, we chop off the cervix. Fothergill surgery, the main thing is cervical amputation. Fothergill surgery, we are supposed to do, or we do a सर्वाइकल एम्प्यूटेशन, तो क्या होगा? So what will happen? That means that, sir, if this is the uterus, if this is the uterus, if this is the uterus, and this is the cervix, in Fothergill we chop off the cervix. We chop off the cervix and you create a new cervix. Okay. Now this will lead to the cervical incompetence. Yes, cervix can become too loose, preterm labor, PROM, abortion, second trimester abortion. Cervical amputation से होगा cervical incompetence. We'll discuss this on Monday. Incompetence, and it will lead to second trimester abortion, second trimester painless. Are you getting my point? Painless abortions. So all these are very important, and therefore Fothergill is not to be done when the patient, this is specifically nulliparous patients, बोलेंगे आपको young nulliparous patients, I avoid Fothergill because fetus, yes, fetus cannot be, fetus cannot stay till the term, and there could be risk of cervical incompetence, even preterm labor, all that complication can happen. Okay, and therefore what is the best? Yes, all of you correct. Akshay Kumar movie had come, Sing is King, and you will remember this as Sling is King. Last year MCQ also surely repeat. We have to remember it either as a sling surgery, also called as cervicopexy. Sling surgery, also called as cervicopexy. And याद रखना है, sling is king. Is this understood to all of you? So sling surgery or cervicopexy is preferred in a young lady with prolapse, and we avoid Fothergill. We will avoid Fothergill surgery. Okay, clap. Is this understood to all of you? Yes. And the last thing which I would want to tell you is about the young patients. Always sling is preferred. Yes. Now, all of you please pay attention. The last thing, hysterectomy steps, sometimes they may ask you, and the steps are similar. Whenever I am doing a hysterectomy, whether I do a abdominal hysterectomy or a vaginal hysterectomy, the steps are identical but in reverse order. Common sense. Now, please pay attention. In abdominal hysterectomy, so first there are the round ligament and the cornual structures, round ligament and the fallopian tube. Then you have the uterine vessels and the uterine artery. So uterine vessels, and lastly we have got the uterosacral ligament and the cardinal ligament. Now please pay attention. When I have to remove the organ, of course I cannot directly start cutting, there will be bleeding. So you apply the clamp. Clamp क्या होता है? Please pay attention. Clamp is what? Clamp is an instrument to control the bleeding. That means first I apply the clamp. You apply the clamp and then I cut. I apply the clamp and then I cut. I apply the clamp and then I cut, and then I ligate. Then of course you suture it. Either you vessel sealer, you use thermal energy or heat or whatever to vessel sealing. Yeah, basically we use a stitch, and stitch marke we secure the pedicles. Okay, so this question has been asked to you in the exam, that when I am doing abdominal hysterectomy, which clamp is placed first, or if I am doing vaginal hysterectomy, which clamp is placed first. Now when they say first, मतलब के first आप किसको clamp करोगे. Okay, so please understand this. I am first telling you for vaginal. Okay, first telling you for vaginal. And same picture. I'm just dividing into two halves so that in one picture only we see both. Now, can you tell me in vaginal hysterectomy, where will you start cutting? Vaginal hysterectomy, we are going from what? From below upwards, isn't it? You will start cutting from below and start going upwards. So, in vaginal hysterectomy, first clamp will be applied on the uterosacral ligaments and the cardinal ligaments. The second clamp, then I go up. Second means it understood left right. So first left, then right, left right. Then second clamp, मतलब first में दोनों होगा. First में it's both. Like first में left side, right side. That's understood. Second structure what I clamp is the uterine vessels. Of course on both the sides, left and right. And lastly, we clamp the cornual structures and the fallopian tube, and the uterus will get freed and I can deliver the uterus. Thumbs up. Is it clear? Abdominal hysterectomy, the same thing is done, but in the reverse order. Common sense, when I open the abdomen, first I am going to see the cornual structures. I open the abdomen, so I'll see the fundus first, cornual structure. Then I will go down. I will clamp the uterine vessels. And lastly, I will clamp the uterosacral ligaments. Of course, on both the sides. By left, right, bilateral is understood. Clamping is done bilateral. Is this understood to all of you? Can I get 10 thumbs up? Very important. So I'm telling you what you have to keep in mind. You have to keep in mind this thing, that you have to keep in mind this thing, that you have to keep in mind this thing, that sir, in abdominal hysterectomy, first we clamp the cornual structures, then we clamp the uterine vessels, and the third last clamp is the ligaments, the niche wala ligaments. Okay, which ligaments? Uterosacral plus transverse cervical ligaments. And vaginal में same, but reverse order. Vaginal में ये uterosacral and transverse cervical ligament will become number 1. Vessels is number 2 only, and cornual structure is number 3. Is this understood to all of you? So the steps are identical, but only thing in reverse order. So in abdominal hysterectomy and vaginal hysterectomy, the clamp order is very important asked to you in the exam. Okay, just remember कि vagina नीचे से ऊपर जा रहा है तो first I clamp the uterosacral ligaments. Left right is understood. Uterosacral ligaments. This is the uterosacral ligament and transverse cervical ligaments. Left right. Then the uterine vessels, and then you go up cornual structures. And यहाँ पे same होगा, but abdominal same. Is this understood to all of you? Yes. So grid classification, grid staging, and lastly, the last thing, which is again the recent data. So all the recent data which I have to tell you, and last thing is again the question which could be asked to you is the Palm-Cohen classification. Virgin MCQ. The question will come. Palm-Cohen classification is used for cervical cancer, prolapse, abnormal uterine bleeding, infertility. Chalo, tell me the answer. Palm-Cohen classification is for what? Palm-Cohen is for fibroids, beta. Palm-Cohen में fibroid आएगा. Yes, Pranav. So absolutely new. Please keep this in mind. Palm-Cohen classification is for abnormal uterine bleeding or they can give you in the option heavy menstrual bleeding, okay, or menorrhagia, where each word, okay, P stands for polyp, A stands for adenomyosis, what we discussed. L stands for fibroid, okay, leiomyoma. Is it clear? M is malignancy. M is malignancy. C is coagulopathy. O is ovulatory dysfunction, which is common in the both extremes of age group. Young patients, young girls, HPO axis imbalance, old ladies, ovulation is not happening properly. So endometrium builds up. Unopposed estrogen, and that is heavy. E is any other endometrial causes. I is iatrogenic, like it could be your IUCD have inserted or patient is on blood thinners, yes. And N is not yet classified. Okay, so this is your Palm Cohen classification for abnormal uterine bleeding. Please keep this in mind. It's a recent advances, virgin MCQ, surely coming in the future examination. Okay, so okay, so that is what we had covered today in the 4 hours time. All the gynecology very rapidly, almost all the topics: amenorrhea, menorrhagia, cancers, PCOS, infertility, endometriosis, all that we have covered. And we will now be meeting you on Monday. Timings will remain the same. On Monday morning 9:30, all of you get ready, and all of you for all the OBS MCQ, beautiful double marker, triple marker, PPH, APH, ectopic pregnancy, of course, whatever possible maximum, we will try to cover it. And on Monday morning, all thumbs up when you leave. Please tell all your friends and colleagues about the app also, and about the Insta and the YouTube channel. And I will see all of you on Monday morning. Same thing will happen. We will first show you the questions. You will answer. Then I will again give you the explanatory answers in detail. OBS is much more fun, and OBS has got much more important weightage. But I can assure you, with this, 10-15 marks are in your pocket and you will do very well. Okay. So bye bye. Best of luck. Thank you very much. And I will see you on Monday morning. Yes. Thank you all of you. Thank you.